Amen. All right, and good morning to everyone. Let's go ahead and set forth our appearances on the record. We'll start first with the plaintiff, then we'll move to the defense.
Your Honor, Will Camp, Teddy Parker, Eric Pepperman, and Brianna Switzler for
Good morning, Joe Liddy, Matthew Kaufman, Eric Freeman on behalf of the rural water defendants.
All right, and it's my understanding we have a couple matters to address outside the presence. Is that correct?
We just have a minor matter of submitting some exhibits to be admitted, just to streamline things. And do we have anything to do with Ms. Murad? I don't know if we got the total from her, or we were going to figure out the total.
You have the total, don't you?
I have her.
Yeah, figure out the total.
I did not.
Figure out the total, well, you check it, but
All right.
There's some math to do, I guess,
So
later.
do the math, and what we'll do, we'll have the marshal confirm that figure with us. Just to make
Okay.
sure. All right. So what do we need to do as far as exhibits are concerned?
I just need to, Your Honor, Matthew Kaufman on behalf of Real Water Defendants, very quickly. We had a couple of exhibits that were pre-admitted that there is not the correct, there is a disconnect between the exhibit number and our, what we had submitted electronically. So I'd like
We
to-
can correlate and correct that.
Okay, exhibit 2577, I have a paper copy for the clerk to replace that exhibit in the record. And then,
Okay, and that shall be admitted. How
Okay.
about that?
and then, in agreement with plaintiff's counsel, we are going to, submit exhibit 2604,
I'm sorry, what was that?
2604, sorry.
Thank you.
And,
That shall be admitted.
and then we just have another paper copy for exhibit 2700, just to replace an exhibit that had some extraneous materials that were irrelevant.
Okay, and that shall be admitted in lieu of.
Can I approach, Your Honor?
You can. Yeah, go.
And then counsel, we have all of the jury questionnaires, are we able to shred those after the trial, or?
Yes, that'd be fine with Real Water.
Thank you.
we agree.
All right. And that way we don't have to send that down to storage somewhere in the bowels of the courthouse. I don't know where they go, but they go somewhere, right?
There's no room for them.
There's no room for them. That's what I've been doing. All right. Are there any other issues we need to address outside the presence?
Not from Real Water, Your Honor.
Not for Plainville.
So it's my understanding we have, what, 2 more witnesses? Is that it?
That's correct, Your Honor.
Okay, what I'll do then, I'll step down, but as soon as the one, and I think one had, was a car problem, Mr. Marshall?
Yes, Your Honor. One of our jurors had some vehicle issues this morning. It was being resolved, and we were making sure that they were here safely and not quickly.
All right. Mr. Parker, you got a question?
Well, we got time, Your Honor. I don't think this will take but a second. I have no idea what Dr. Alcina may testify to today, but I brought copies of the order just to help in the event he verges into opinions related to Lucam.
He will not be, not unless he's asked that on cross.
Okay. And the only other thing I would mention is, and I appreciate that, Joel, the only other thing I would mention, having reviewed the transcript and the argument, it's my understanding that that means any other opinions derived from a RUCAM analysis would also be precluded. So if he's not basing opinions on RUCAM, then I don't think we'll have a problem.
He will not be offering any causation opinions.
No.
Again, unless you ask him something on cross.
I will not. Thank you, Your Honor.
All right. All right, and so we're still waiting, huh?
Yes, Your Honor. You'll step down.
Yeah, I'll step down.
All rise.
15 minutes, maybe.
That's good.
It's going to be a recess to further notice.
Just call you over the weekend.
Department 16 will not come back forward. Please be seated. Thank you.
It's my understanding, panel members here. And so, how long do we think the remaining testimony with the
Excuse me, I think with cross-examination, I'll probably take the remainder in the morning, Your Honor. I don't know. How long do you plan on going, Will?
I don't think I'm long.
It's Mr. Parker.
I'm looking around. Brianna's right behind him, maybe that's what she's referring to.
I think we'll be done by lunch, or shortly thereafter at the latest, Your Honor.
Judge, we brought lunch in for jury.
Okay, that's good. Forgot about that.
All rise to the jury. Please be seated. Thank you.
All right, do the parties stipulate to the presence of the jury?
Yes, Your Honor.
Yes, Your Honor.
Okay, ladies and gentlemen of the jury, I just want to say good morning to you, and I hope you enjoyed your weekend. All right, and it's my understanding we're going to continue with the defense case in chief, and we'll hear the defendant's next witness, and that will be?
Your Honor, defendants would like to call Dr. Howard Robin to the stand.
Okay.
You do solemnly swear the testimony you are about to give in this action shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
May I have you state and spell your name for the record?
Howard Stephen with a V, Robin.
Thank you. Please spell it. Spell it, please.
R-O-B-I-N.
Thank you.
You may proceed, counsel.
Can we put up Dr. Robin's slideshow, please, Joe? Good morning, ladies and gentlemen of the jury.
Good morning.
Dr. Robin, good morning.
Good morning.
All right, so we got that up. Trope, could we go to the next slide? Ooh, I did not anticipate that appearing so lime green. I apologize to everyone. Dr. Robin, can you please introduce yourself to the jury and give us a little bit about your background?
Sure. I graduated from Pennsylvania State University and then went to Jefferson Medical College in Philadelphia. and did a rotating internship at Chestnut Hill Hospital outside of Philadelphia. And then I did an anatomic and clinical pathology residency at Jefferson. And after graduation, I did a research fellowship at the Scripps Research Foundation in La Jolla, California, and board certified in anatomic, clinical pathology, and immunopathology.
And doctor, not to pry, but how long have you been practicing medicine?
Well, 52 years,
And how long have you been a board certified pathologist?
48 years.
And can you tell us a little bit about your experience as a pathologist?
Yes. From 1978 to 1982, I was pathologist of the coroner of San Diego, where I became interested in deaths that were due to drugs, most commonly drugs of abuse. And from that experience, I authored an atlas on the adverse effects of IV drug abuse. I was a medical director of a number of commercial and clinical laboratories where toxicology studies were performed, and spent most of my career in a hospital in San Diego where I was the liver pathologist. And so for 32 years, I looked at liver biopsies for our group that covered 3 hospitals in the San Diego area, and looked at thousands of liver biopsies.
And it's my understanding your research led to the discovery of a new liver disease. Can you explain that to the jury?
Yeah, it wasn't a liver disease, it was a disease of fibrosis. Besides doing liver pathology, I also did kidney pathology, and the renal pathologists or the renal doctors came to me and said that they had these patients with this unusual presentation. If you looked at them and you knocked on their skin, it would sound like you were knocking on wood. It turns out that the biopsy showed something that was entirely unique, and we had 9 cases and published that, and a new disease was identified called nephrogenic fibrosing dermopathy. And I'll break it down for you. Nephrogenic means related to the kidney, and these were all kidney transplant patients. Fibrosing is the fibrous tissue, the scar tissue that we see when you cut yourself, and scar tissue that we're going to see in some of these liver cases. And then nephrogenic fibrosing dermopathy, and it initially was only involving the skin, but then subsequent to that, cases were reported where this fibrous abnormality was throughout the body in multiple organs. And it was then identified that there was a dye that the radiologists were injecting into the patients so that they could look at their renal arteries. And this dye had a chemical called gadolinium. And gadolinium was responsible for nephrogenic fibrosing dermopathy. And now it's been identified worldwide, but we had the first publication and identified the first 9 patients.
Thank you, doctor. So can we go to the next one? All right, doctor. The jury's been, we've had a very attentive jury here, and they've heard a bit about liver, general liver biology and stuff like that. Can we just do a real quick summary for the jury to orient them to what the important parts of what you're going to testify to today?
I personally think the liver is probably one of the most important, if not the most important organ in the body. I have a friend who's a kidney doctor, and he argues with me. He thinks that the kidney is more important. But am I allowed to?
Your Honor, can you step down to the screen?
Yes, you may.
And Shane, can I borrow your pointer, please?
So this will be important because we're going to be looking at a number of liver biopsy slides. But not all the cells in the liver, which we call hepatocytes or liver cells, have the same job. Some of them have different jobs, and it depends on their zone. You've heard about portal triads. portal meaning portal like the opening of a door, a portal. And in the portal triad, there are arteries, veins that are blue. The arteries red because the blood from here is oxygenated, and the green is for the bile. And it's interesting, the blood flows from the portal triad to the central vein. We now call it the terminal lobular vein or venule, whereas bile comes in the opposite direction. And that's what this graphic up here shows. The blood is going from the portal region to the central vein. And the reason why blood has to go in this direction is because the cells have a different function, they have a different job. And the ones in zone 1 are involved in beta oxidation, so they're involved in metabolism. Whereas as you move from zone 1 to zone 2 to zone 3, the job changes. And the job here is to make triglycerides. Triglycerides are fats. And we don't want to have fat in the liver because fat is pro-inflammatory. We don't want inflammation. Beta oxidation decreases as we move in this direction, and lipogenesis just means this is where fat occurs. But most importantly, zone 3 is where drugs are detoxified. So if there's going to be a toxin that the body takes in, probably through digestion, comes in through the portal vein, goes to the central vein or terminal lobular vein, and these cells here in zone 3, it's their job to detoxify that chemical. But if that chemical is toxic, most commonly it kills cells in zone 3.
Okay. Thank you, doctor. Okay. So, can we go to the next slide? All right. And just very quickly, you know, the jury's heard this too, but can you give the jury a little bit about plaintiff's liver injuries here and the cause of them?
Yes. The liver injuries were more likely than not due to a chemical known as hydrazine. And hydrazine has 2 nitrogens and 4 hydrogens, and it's been shown in animals and in humans to be toxic. The plaintiff's liver injuries were due to this hydrazine, this nitrogen compound, and it can cause liver failure, which would be defined as individuals who present and they're confused, they're dizzy, they're disoriented, and they also have abnormalities in the protein that's important, or the proteins that are important to help with coagulation. So when individuals have a prolonged INR and they present with the signs and symptoms of confusion, headache, etc., and associated with liver abnormalities, that would be defined as liver failure. And sometimes liver failure is associated with fibrosis. Fibrosis is basically scarring.
Okay. Next slide, please. Next slide, please. All right, doctor. One of the things you talked about, that you and I have talked about outside of court, is the liver's ability to regenerate. Can you kind of give the jury a little short bit on that?
Yeah. The liver is remarkable.
Your
in fact.
Honor, can he step down?
Yeah, you can.
I'm so sorry, Your Honor. Go ahead.
Yes, it's remarkable in its regenerative capacity. And remember, I told you that zone 1 is closest to the portal region, and here metabolism occurs. Zone 2, I didn't tell you what it did. And zone 3 is where detoxification occurs. This is where, when antibiotics cause a liver injury, it occurs in zone 3. Zone 2 has hepatocytes or liver cells that have the capability of repopulating dead cells, cells that were injured in zone 3. Or if cells were injured in zone 1, this zone 2 is the backup. And these cells then have the ability to divide. And the cells that have the greatest ability to divide and to repopulate in areas with injury are those from children. Children have an incredible capacity, and that's because they have the right number of chromosomes in each nucleus. Whereas when you get older, the number of chromosomes increase, and your ability to repopulate is not quite as good. Also, older individuals, they have maybe other underlying diseases associated with metabolic syndrome, diabetes, etc. But children are very good at repopulating as long as the scaffolding, known as the reticulum network, is intact.
If you want to stay there for a minute, Doctor, I think as long as you're comfortable, I think we can kind of, this way you don't have to keep going up and down. Can we go to the next slide, Joe? And this next slide is just kind of a summary of what you just talked about, correct, Doctor?
Yes.
Okay. Next slide, please. All right, so next we're going to kind of talk about a couple of common pathological findings that the jury's heard about. Let's start with, and I'm going to pronounce it right, steatosis, right?
Correct.
All right, that's the first time I've done it right this week. Please go ahead, Doctor.
So, steatosis just means fatty change. And so what you see is fat inside of the liver cells or hepatocytes. Steatosis is reversible. Steatosis occurs in individuals who have metabolic problems, diabetes, or something known as metabolic syndrome. It occurs with alcohol, and what happens is that the liver cell ends up with too much of those triglycerides. So when you look at it under the microscope, the cell is enlarged and the nucleus is pushed to one side. It actually looks like just one clear space. The nice thing about steatosis is it's reversible. When you remove the toxin or the alcohol or you improve the metabolic syndrome, the fatty cells go away. They are reversible. They'll go back to normal.
Okay, next slide, please. All right, Doctor. We actually, this is one of the slides from one of the plaintiffs in this case, Ms. Carla Moreno. Can you kind of show the jury on this slide where steatosis is, just to help them get a better visual picture?
I hope your vision is, you're farsighted, so you'd be able to see this better than I can up close.
Can you zoom in? Can you zoom in on that a little bit, Joe?
So a lot of these empty spaces here are actually hepatocytes that have steatosis. And you can see that the nucleus is pushed to the outside of the cell. So the fat globule pushes the nucleus to one side. When individuals change their diet, reduce their need for insulin, get better in terms of their metabolic syndrome, they stop drinking alcohol, or they stop being exposed to whatever toxin caused the steatosis, these cells can go back to normal.
Okay. Next slide, please, Trope. Next, can you tell the jury, what can you tell the jury about, that should be ballooning hepatocytes. Apologies for the typo.
So the ballooning hepatocytes, that's a different story. These cells are 2 to 3 times the normal size, and they represent a dying cell for the most part. Cells in our body turn over all the time, especially in the liver and also in our intestinal tract. We don't have the same cells from childhood through late adulthood and old age. These cells turn over. When they turn over, it's a process known as apoptosis, which is a difficult term to pronounce sometimes, but that's the body's normal way of getting rid of these old senescent cells. And A ballooning hepatocyte is a cell that's undergoing apoptosis. It's 2 to 3 times the normal size, and the nucleus shrinks, and it's very small, and then sometimes it even breaks apart, and another fancy term called karyorexis, where the nucleus breaks up into small parts. And that's ballooning degeneration of hepatocytes.
And once again, this is a slide of Mr. Adir Ida, who's one of the plaintiffs in this case. Can you show the jury on his slide where the ballooning hepatocytes are?
Can we blow that up as well?
Yes, of course.
So I'm looking for a cell that's going to be 2 to 3 times the normal size of a normal hepatocyte. This cell is larger, but I need to find a cell that's larger and also has a nucleus that's pushed out to one side, or where the nucleus is broken up into small pieces. Maybe over here is a ballooning hepatocytes and the breakup of the nucleus.
Okay.
In some cases, ballooning hepatocytes go back to normal, but it is a form of dying liver cells.
Okay. Next slide, please. All right, doctor. I know the jury's heard quite a bit about fibrosis already, but can we just kind of sum it up for them so we can, to help with your testimony?
Sure. So fibrosis or scarring can occur in 3 areas of the liver lobule. It can occur in the portal regions. It can occur in that central vein, now known as the terminal lobular vein, or it can occur in the sinusoids. The sinusoids are where the blood passes from the portal tract to that central vein or terminal lobular vein. So we have sinusoidal fibrosis occurring in the sinusoids. It's amenable to reversal, and that's because of its location. Because these cells have a capacity, or there are cells besides liver cells that make an enzyme, collagenase, that can break down the collagen or the scar. We have collagen throughout our body. We have collagen as a supporting mechanism for the portal triads. The blood vessels and the bile duct, they're surrounded by collagen. That's normal. We have collagen that attaches our muscles to our bones, known as tendons. Collagen are normal, and then of course we can cut ourselves, we'll get a scar, and after a year or 2, hopefully it will be very small and you won't see it. So collagen can go away. Collagens make up scars. Scar, another name for scar, is fibrosis. You can have portal fibrosis. You can have bridging fibrosis. Sometimes you have fibrosis that goes from portal tract to portal tract, and in other cases you have fibrosis that goes from portal tract to that central vein, also known as the terminal lobular vein. In terms of reversibility of fibrosis, the place where it's most likely to be reversed is in the sinusoids, followed by in the portal regions, and then the most serious is when you have portal to central vein fibrosis.
Can you demonstrate some of that? Can you provide, strike that, let me restart. Can you provide, give the jury a visual representation of what you just talked about using Ms. Wee's slide?
Sure. Can we turn it around and do it? No, that's okay. That's fine. So this is a portal tract, right? And you can see the large vein, an artery, and there's a duct in here that I can't see. This is a trichrome stain, and the trichrome stain is a special stain that allows us to see fibrous tissue. And we can see that normally around the central vein, there's fibrous tissue that's blue. In this case, it's kind of pale blue, but it's blue. We also see in here, it's not a portal tract, but we see fibrous tissue that's blue, and it's between hepatocytes, and that's known as sinusoidal fibrosis. And remember, this is the type that more likely than not can be reversed. And then this is a big central vein, and you can see that there's fibrous tissue normally in the liver. This is a normal wide open central vein in the biopsy of Daisy Way, and this is a special stain known as a trichrome stain.
Next slide. And, you know, again, just trying to give the jury a visual representation of the other kinds of fibrosis. This is a slide from Ms. Branch Note, correct?
This is branch note, yes. And so here we can see sinusoidal fibrosis. We see the central vein. We see some fibrosis around the central vein. This is a portal triad. We can see a bile duct here, and we can see that there's fibrous tissue here and fibrous tissue here. This is a portal to portal area with fibrous tissue. The problem here is that sometimes the pathologist can overcall this, and it's because of the fact that if you cut the tissue along the longitudinal aspect of the portal tract, it will look like bridging fibrosis. So pathologists who are experienced have to look very carefully to make sure that they don't overcall a liver biopsy as having bridging fibrosis.
Doctor, out of the patients you reviewed for this case, are there any biopsy slides you reviewed that showed like really good examples of like extensive fibrosis?
Yes,
And who would that be?
that was Mr. Henry.
Can we go to the next slide, Sean? Next slide. All right. And can you? This is a micrograph that you took, correct?
Yeah, it's a photo micrograph, yes.
Photo micrograph. Okay. And can you explain to the jury what this is and why you believe this is important?
Yeah, so this is the portal region, and you can see these are bile ducts. And this is blue stuff here is collagen or fibrous tissue. And the collagen goes here and here and here. And then over here, there's lots of fibrous tissue between individual hepatocytes. Can we have a second slide on this?
Yes, we do. Can we go to the next slide?
And so here you see the fibrous tissue going all the way around, a big, dense band of fibrous tissue, very thick. And so if this was a normal lobule, what would we find in the center? We would find the central vein. But there is no central vein in the center. And the reason there's no central vein is this is a regenerative nodule. So this area here, if we just had this, it would look normal. But we have the fibrous tissue and no central vein. We have fibrous tissue, no central vein. And if we had more of this, we would have fibrous tissue, no central vein, increased fibrous tissue, really thick fibrous tissue. This is end stage, stage 4 cirrhosis.
Next slide, please, Drew. And Doctor, the jury heard Dr. Datnow talking about Severin Morales, who was a 22-month-old child who was injured by river water. How does Mr. Henry's slide compare to Severin's?
This is Severin, right?
That is Severin, yes. Yes, sir.
Yeah.
We can just, can you zoom out real fast, Tripp, just so the jury can see that?
So remember what I had said about a regenerative nodule indicates cirrhosis. In a regenerative nodule, we don't have a central vein. Dr. Datnow very nicely pointed out the central vein here, it's normal appearing. Yes, we have scar tissue here. We have some scar tissue here, but a lot of the scar tissue is going around the hepatocytes. And this is sinusoidal, not necessarily bridging fibrosis. Like there's no bridge here. There's fiber strands here, but you have a really nice central vein. So I would argue that this is not cirrhosis. Maybe you have bridging down here, but we don't see it. Maybe this is just a large portal region, but this is not a regenerative nodule. This is not cirrhosis.
All right, Doctor, thank you so much. I think that's enough background. I think the jury's heard a lot about all of us talking about livers for a long time. Why don't we get into your review of the individual plaintiff's biopsies? Next slide. Let's start with Ms. Brandy Wren. What can you tell us about your slide? And Doctor, if at any point you want any of these slides up on the screen, please let us know and we'll have them put up for you.
The staging of fibrosis is subjective, meaning that different observers may have different opinions about the amount of fibrosis and the stage of the fibrosis. Some people are liberal and some people are hard graders. And hard graders may see something a little bit worse and a little bit more ominous than easy graders. I'm more of an easy grader in that I spend a lot of time talking to the liver specialists, whether they're a hepatologist or a gastroenterologist who specializes in liver disease. And the dialogue or discussion is about three things. One, what does the patient have, which is the diagnosis? What caused it, which is the etiology? And how bad is it, which is the prognosis? And then a fourth thing is how to manage the patient. And so being conservative in terms of staging allows the treating physician, the gastroenterologist or the hepatologist, to have that discussion with the patient that this is not the end of the world and that there's a good chance that you'll get better, that this is not cirrhosis. Some people are not as lenient as I am, and maybe they would go 3 out of 4, which Dr. Datnow did with Brandy Wren. I didn't think that it met my criteria for bridging fibrosis, so I went 2 out of 4.
Okay. Next slide, please, Chuck. What about Carla Morena?
Again, pretty much the same story. I went with 2 out of 4. Dr. Datnow said 2 to 3 out of 4, and he didn't see cirrhosis, so we're pretty much on target there. If he's 2 to 3, so he's somewhere in between. Maybe he called this a 2B. You know, sometimes you had teachers in high school and they were easy graders, and sometimes they were hard graders. Dr. Datnow probably, if he was a high school teacher, would be a hard teacher.
All right, next slide, please. What about Mr. Ida?
Mr. Ida, Dr. Datnow's initial report and review, he didn't see any evidence of fibrosis, but during his testimony last week, he went to 2 out of 4. I personally didn't see any real fibrosis in Mr. Ita's biopsy. You know, there was a little bit of blue in the portal region that we saw, but at worst it's a 1, but I would probably say no fibrosis.
Next slide, please. What about Ms. Branchinoto?
Branchinoto, again, Dr. Datnow went 3 out of 4. He said close to cirrhosis, and I went 2 out of 4. There was ballooning degeneration that I observed.
Okay. Next slide, please, Trope. And finally, Daisy Wee.
Daisy Way, Dr. Datnow went 3 out of 4, close to cirrhosis. I was stage 2 of 4, focal, maybe early bridging fibrosis. The problem with Daisy Way's biopsy, and you saw that earlier, instead of being a dark blue, it was a light blue. And that light blue makes me think that maybe the stain wasn't perfect, and maybe that's the reason why. it looked to Dr. Datnow as if there was bridging fibrosis.
The jury's heard a little bit about something called the Burke article, which was a case study done at Loma Linda involving 4 people who had consumed real water. Ms. Wee is one of the people in the Burke study, is that correct?
That is correct.
Do you remember what how the doctors in the Burke study graded her fibrosis, if they did?
Yeah, they said that there was some portal collagen, portal fibrosis, but they didn't say there was bridging fibrosis, whereas in case number 4, they definitely saw bridging fibrosis. So if indeed bridging fibrosis was present, they would have included it in their paper, which they did not.
And Doctor, I'm almost done. I just have a couple final questions for you. Based on your experience, your years of pathology, what do you, from a pathological standpoint, setting aside Mr. Henry, who had a liver transplant, what is your prognosis for the plaintiffs, the slides you reviewed?
Good question.
Yeah.
Apparently, they're gonna move on, Mr. King. And counsel, thank both of you for your assistance.
Actually, Doctor, let me withdraw that question. I have a different final question for you. There are several plaintiffs in this case who did not have biopsies taken. Do the biopsies that were taken tell us anything about the remaining plaintiffs' livers?
No.
And finally, Doctor, all your opinions today were to a reasonable degree of medical certainty, correct?
Yes.
All right. That's all I have for you now. Thank you.
Thank you, sir.
I think you still got it. Did you want the pointer one? I do. All right. Your Honor, may I approach the witness?
Yes, you may.
Thank you, Your Honor.
I keep track of these things, you know?
You're one step,
You
actually.
know, they disappear. Get my pointer. Morning, ladies and gentlemen. Morning, Dr. Robin. How are you today? Okay, Doctor, initially, when you were engaged in this case, you were engaged only to look at Mr. Henry. Is that correct?
Yes.
And in fact, in your initial report, you don't talk about Randy Rand or Brent Schnoda or David Reed. Not covered in your initial report, right?
That's correct.
Okay. So it's kind of an afterthought that you brought on for these people?
You'll have to ask that of Mr. Kaufman.
Okay, but initially, they didn't want you to say anything about those people. They just wanted you to focus on Mr. Henry, correct?
Initially, yes.
Okay. Now, Dr. Dadnow is a good pathologist.
Dr. Datnow is a respected cancer pathologist, yes.
In fact, he lives in the same area you do in San Diego, right?
Yes.
So your neighbor?
Probably about a mile away.
Okay. And so you say he's a hard grader and you're a soft grader, is that what I understood?
Yes, I think that's one way in which you could put it.
Okay, so this grading, you said it was subjective, right?
Yes.
So out of the 1, 2, 3, 4, some people will grade a 2 or 3, and some people will grade a 3 and 2, some people will grade a 4 and 3, and vice versa, right?
Right, and that's the reason why many people are moving towards using artificial intelligence in order to grade or stage these biopsies, not only of other diseases, because then instead of having the subjective impression of a pathologist, you would have 0 and 1s, and it would be a more objective stage.
Okay, because it is thought that the artificial intelligence would be more reliable? Is that the idea?
It would be more objective. Of course, it would be trained using expert opinions, and so an expert in liver pathology is different than a general pathologist. And so if you had an expert system that was trained with expert pathologists, you would get a more accurate staging.
Okay, and you haven't done that in this case?
No, we have not.
Okay, so the artificial intelligence could rate it the way Dr. Datnow did, or could rate it the way you did, we just don't know.
Well, it probably wouldn't use Dr. Datnow's. Do you want to know why?
It could rate it the way Dr. Dano did, or could rate it the way you did, we just don't know, correct?
No, I do know.
You haven't done the artificial intelligence, but you're telling me here you know how the artificial intelligence would rate. Is that where it's at?
No, I'm saying that the artificial intelligence would be based on an expert liver pathologist, not on a general pathologist or a cancer pathologist. It would be based on someone who spent their career looking at liver pathology. You wouldn't want a generalist to program your computer. You would want an expert to program your computer.
Well, let's go back to where we were. I think you've already said that Dr. Dadnow could rate the same thing a 3 as you rated to 2, and vice versa. You could rate it a 2, and he could rate it 3, right?
I'm sorry, I missed the end.
He could rate it a 2, you could rate it 3, you could rate it 3, he could rate it a 2.
Well, I don't think there were any cases where he graded it a 2 and I graded it a 3.
I'm talking about in general. This happens every day in pathology, right? One pathologist says 2, one says 3, every day, right?
Well, you want the best eyes looking at your liver biopsy.
Okay, whether you have the best eyes or Dr. Dadnow does, that's not the question. This happens every day. One pathologist says 2 and one says 3, right?
Right, there is variation.
Okay. Now, Shane, can I have figure 2, 1215, please? And this is demonstrative. No. What are we seeing here, doctor?
Whose biopsy is this?
It's a demonstrative. It's not a specific plan.
Oh. Well, can I get up and look at it on a
Sure,
bigger screen?
Sure. Go ahead, doctor.
Is it okay, Your Honor?
Oh, absolutely.
I have no problem with that, Your Honor.
Can I have your pointer?
Sure. Well, why don't you just tell me what it is before you point it, please? What do you see there?
I want to be able to show you with the pointer.
Can you tell me first what you see there?
Sure.
Go ahead.
As we said, this is a trichrome stain. Trichrome stain collagen, fibrous tissue, scars, blue. And we see fibrous tissue, portal triad. And here we see a nodule, and there is no vein in the center of the nodule. Without having a vein in the center of the nodule, that's a regenerative nodule. And this looks like a case of cirrhosis with fatty change, and we have regenerative nodules.
That doesn't get better. Is that correct? That won't get better.
That will not get better.
Okay, when you say you see the cirrhosis, the nodule, that's the white, the dots, the white dots is what you're seeing?
Well, you won't let me have the pointer.
Oh, go ahead. No, this is my point.
It has his initials on it.
Okay. It actually has Shane's initials, but
So this is the nodule. Inside the nodule, inside the nodule are these little white open spaces, and these are probably steatotic cells or cells filled with fat. But again, there's no central vein, and right here looks like a Mallory body, which is also known as alcoholic hyaline. My guess is that there's a good chance that I'm going to suggest to the treating physician that this is alcoholic cirrhosis.
okay, let's see the Morales baby, just so we can get away from the alcohol. Back to the next one, Shane.
Remember which exhibit that was, Bill?
No, I don't.
It's,
So we got 513?
yes, that's it.
Okay, and again, the Morales baby was one of the 5 babies that was flown to Salt Lake.
Can you speak up?
The Morales baby was one of the 5 babies that went to Salt Lake.
I believe so, yes.
And it looks like we have,
Do you have to take that call?
is that better?
Yes.
Okay. And so, do you see the blue that's going around in a circle?
I think.
That's
we're gonna
fibrosis.
Focus on this.
That's fibrosis, correct?
Yes, but we have to talk about where the fibrous tissue is.
Okay. Well, the fibrous tissue's in the center, correct?
And since you're testifying, what do you think this is?
Is the fibrous tissue in the center of the circle?
The fibrous tissue in the center of this circle is the central vein. And as we said before, if you have a central vein, it's not a regenerative nodule. If it's not a regenerative nodule, it's not cirrhosis.
Okay, so you wouldn't grade this as cirrhosis?
I would not.
Okay, and you've read Dr. Datnow's testimony on this point? You've read Dr. Datnow's testimony on this point?
Yes,
Okay, and he rated it a cirrhotic nodule?
yes.
Okay, great. And by the way, cirrhosis doesn't go away, correct?
Cirrhosis does not go away
Cirrhosis is permanent.
unless you have a liver transplant.
Okay, fair. All right, let's go to Daisy Wheat. Shane. Okay, and on the left, I have the one we started with that you said was cirrhosis. And on the right, we have a Daisy Wheat slide from October 3rd, 2020. Correct, Doctor?
Yes,
And you see the blue in the Daisy Wheat slide?
I do.
And that's scarring, correct?
Yes,
And so you said you rated this, I can't remember, 2?
2.
Okay, and when I took your deposition, you rated it a 3, right?
You tell me if I said 3, I said 3.
Okay. So even you go back and forth between a 2 and a 3, right?
Well, from time to time. But you know what? You're showing her first biopsy. Why don't you show her second biopsy?
Okay, well, let's, Doctor, I'm supposed to ask the questions, it goes a little faster. But the 3, you would rate this a 3, the October 3rd, 2020 biopsy, correct?
Yes. I think that it would not be out of hand to call it a 3, but I think that a lot of the fibrosis that we see here is the sinusoidal fibrosis rather than the bridging fibrosis. But go ahead, it's
Okay.
your case.
So remember, it's 1, 2, 3, 4. This is a 3, correct? 1, 2, 3, 4. This is a 3, right?
Yes,
Okay.
I can call it.
Let's go to the next one. Okay, now we got Monica Branch Noto, excuse me. I believe you rated this one a 2, and Dr. Datnow rated it a 3. Is that correct?
Yes.
Okay, and would you rate this one a 3 under certain circumstances?
Who's this?
That's the figure that we started with. I'm just comparing the two. That's the cirrhosis that we started with. That's a demonstrative, Doctor.
Got it.
Okay. Okay, back to Monica Branchnoto.
So this is the central vein, and we see collagen in here. And this is collagen in sinusoids. This is a portal tract, and there's fibrosis coming out. I wouldn't call this a 3.
Okay, but the one on the left you'd call cirrhosis. The one on the left you've already said is cirrhosis, correct?
Yeah, there's no central vein.
Okay. Now, yeah, Doctor, you can take the stand again. Thank you. Now, Doctor, you would agree that bottled water with hydrazine in it can cause acute liver failure or death?
Yes.
And have you looked at the trial testimony of Dr. Kosnet, the toxicologist in this case?
I did.
You did?
I did.
Okay. And did you see his testimony about a rat study where they fed the rats low doses of hydrazine in bottled water?
I did see that.
Okay, let's show it again to the jury just so we can get on the same page. Shane?
So then I looked at studies that have looked at not just animals getting a single high dose, but getting lower doses over a period. And one of the studies that was published was done in Germany in 1988, and they they actually, in this, they gave male and female rats different doses of hydrazine in drinking water. Okay? They gave it to them in the drinking water, and they gave it to them over the course of greater than a year. And then when the animals died, they did autopsies on the animals. And they had started this study because they thought they wanted to look at whether hydrazine caused cancer. It turned out it didn't cause cancer, but one of the things that they found was that it caused an increase in the prevalence of what's called bile duct hyperplasia, or a thickening or abnormality of the bile ducts. And those are an important component of the liver. So this was an example of how chronic exposure to hydrazine at lower dose that didn't kill the animals right away caused them to develop abnormalities in the liver.
Okay. So, doctor, in this study, they gave bottled water with hydrazine in it to rats. The rats died, correct?
Yes.
Do you know of any study that has ever been done of this sort on human beings?
No.
Okay. So this is the best information we have as to what happens when you feed an animal bottled water with hydrazine in it at a low dose, correct?
No.
This is not the best information.
No.
Okay.
You want to know why?
Well, first of all, tell me what is the best information.
Mm-hmm.
What is the best information?
Best information is doing studies on humans, which is unethical. But I've spent the last 10 years doing studies on rodents, and I work for pharmaceutical companies and clinical research organizations, and what you find in animals doesn't always apply to humans. In fact, if you take a human and you give them morphine, they're going to be sedated. You give morphine to a cat, and they'll be excited as if they were on a stimulant. If you give penicillin to a human, it'll kill a bacteria. If you give penicillin to a rabbit, it'll kill the rabbit.
But
There are differences in terms of animals and animal metabolism, animal enzymes, animal genetics. All of these things enter into it. So studies that are done on rats showing that if you feed them water is not necessarily applicable to humans.
Okay, but this is the best we have. We don't have any study on humans. You've already said that.
Right. Well, this is the best that you have, yes.
Okay, and in this study, you talked about the liver gets better and regeneration and all this stuff. None of these rat livers got better. They all died, right?
Did they stop the water?
Did I ask you if the rat livers got better? That was the question. Did the rat livers get better?
Well, there's no literature to support that they stopped the hydrazine, and therefore you have the continuous exposure to the toxin that continues to kill the liver cells. Whereas in the individuals who took real water and were exposed to hydrazine, they stopped taking the real water. They were no longer exposed to hydrazine, and there is no reason to believe that they would continue to go on and develop additional liver disease.
So I guess what you're saying is they're exposed to some other toxin during their life. They may die because of the pre-existing damage done by the hydrazine. Is that correct?
No.
No.
I'm saying that individuals who have taken one hit to their liver should be very careful about their liver and have a balanced nutritional diet. They should stay away from alcohol. They should exercise. They should eat the right foods.
These people, because rocket fuel has been exposed to their liver, they're at greater risk than other people. Correct?
Yes.
And you can't quantify that. You can't tell me 20 years from now, Daisy, we will have a serious problem, or 10 years from now, Branch Shinoda will. You can't quantify that, right?
No, I cannot. I don't have a crystal ball.
Okay. Okay. Now, is it correct that assuming that, Daisy, we had bridging fibrosis 3, you can't say one way or the other whether it's gone away?
No, but I would want to be optimistic with Daisy Wee and tell her that she shouldn't take supplements or drink alcohol, and that she should have a good nutritional diet.
Okay, optimism's wonderful, but you can't tell one way or the other whether this bridging fibrosis for Daisy Wee has gone away. You can't tell.
I can't tell that it's going to go away, but if you remove the inciting agent, which is hydrazine, there's a good chance it won't progress.
So it'll stay the same. It'll stay at stage 3 bridging fibrosis. Is that what you're saying? It won't progress to cirrhosis, but it'll stay at bridging fibrosis.
I would like to believe that, yes.
Okay? And that's the hopeful, optimistic view, correct?
It is.
Now, would your answer be the same for the other plaintiffs, Branchinoto, Marino, Adair, and Brandy Wren? You don't know one way or the other whether whatever condition they had, as depicted in this slide, has gotten better or worse. You don't know.
I think if indeed their liver disease progresses, potentially they've been exposed to another liver toxin, something else that could injure their liver. But as it stands with the biopsies that I saw, I have no reason to believe that it will progress if they stop their exposure to hydrazine.
Okay, and whether it progresses or not, they have a permanent injury that makes them more susceptible, correct?
Well, that's not necessarily correct, in that we know that individuals who have stage 1 and stage 2 mild and moderate liver fibrosis, they do resolve and they get better.
Daisy's not getting better, is she?
Well, that's your testimony.
I'm asking you. Daisy with stage 3 is not getting better, is she?
Better, you asked the question.
Okay.
And the answer is, I don't know.
Okay. Thank you, doctor.
All right. Can you do the record?
Very brief. 794. Page. None. All right, Doctor. May I proceed, Your Honor?
Oh, yes.
Okay. Very quickly, Doctor, during cross-examination, Mr. Kemp showed you one of Daisy Lee's biopsy slides, correct?
Yes, you did.
And that was from October of 2020, correct?
Yes.
And she later had a subsequent biopsy done, correct?
1 month later.
Okay. And up on the screen right now, we have that second biopsy. Can you just very briefly explain to the jury why your opinions are the way they are and the importance of this second biopsy?
Yeah, I think the second biopsy looks better, and I certainly would go with it. Your Honor, can I stand?
Yes, you can.
Now, I don't know whether it's an artifact or not, but here's dark blue that we see around the central vein, right? This is the central vein, the middle of the lobule. And it's a little bit lighter here. And you know, the lighter color makes me think that maybe this is overstained. But I think a lot of this connective tissue is around the hepatocytes, the sinusoidal fibrosis, which is reversible. And I think here you may be seeing a portal triad that is cut longitudinally. And so I think that actually this looks better. This is where I went to. I think that Daisy was getting better 1 month after her initial biopsy. And unfortunately, when I was shown the biopsy previously, that was October. This is November. I'll bet you if she was biopsied today, she would have a nice, clean liver.
Thank you, Doctor. No more questions.
Okay, thank you. Thank you, doctor.
Doctor, 1 sec. We need to wait for your questions.
Sorry. These are the best questions.
All right, Doctor, we do have one question from juror number 11, and is that Barbara Rich?
Barbara.
Barbara, I always don't get the Rick. I
Yeah,
get the-
ignore the H, you'll get it right, I promise.
Okay, all right, thank you, sir.
Yeah.
Anyway, the question is as follows, quote, "In the biopsy, we see a large central veins and small central veins. Does that affect your grading when looking at the slides?" Period, close quote.
Excellent question, yes. So the liver, we looked at lobules, and in some of the lobules, veins are smaller than others, and we call those venules for small vein. And that's the reason why you see a difference. But the fact that you saw the large one and the small one, and looking at the biopsy, both the large ones and the small ones in different biopsies look pretty much the same. But you would see probably the changes occurring in the smaller veins first, and then in the larger veins.
All right. Any follow-up, counsel?
No, Your Honor.
Okay. All right, Doctor, you're released.
Thank you, Your Honor.
Can we approach quickly? How's the jury doing? Need a break? You're doing good?
Yes.
All right. Did someone want a break? And, of course, I have to respect that. I do. But we'll make it quick. Remember, you're admonished not to converse amongst yourselves or with anyone else on any subject connected with this trial, or to read, watch, or listen to a report or a commentary on the trial by any persons connected with this case by any medium of information, including without limitations, newspaper, television, radio, social media. And last but not least, to inform or express any opinion on any subject connected with this trial until the cause is finally submitted to you. And as soon as they're finished, we're ready to come back in.
I'll ask for the partial jury.
Okay, thank you. So lastly, where are we at on jury instructions? They're done, completed, ready to go?
They are, Your Honor.
That's good. Verdict form too?
Yes, Your Honor. We'll have an issue with if there's a phase two to deal with, actually a couple issues, but we're ready to go.
And I think you'd indicated that last week. That's the only, yeah, all right. So we'll take a break when they're ready, we're ready. And, so we'll be able to read jury instructions before lunch, is it?
That's right, okay, I'm gonna talk to Mr. Parker right now.
Okay. Let that conversation begin with Mr. Parker.
Back to work. Seated, thank you.
All right, I think we're ready to bring him back in, right?
Yes, Your Honor.
anticipate the testimony to take?
20 minutes? Direct, yeah. I wouldn't speak for Mr. Clinton.
I wouldn't speak for Mr.
Your Honor, if I could approach, I have a copy of the jury instructions and verdict form that we have agreed upon.
All right, you may approach, sir. Nothing unusual.
All rise to the jury.
Wrong about it.
Please be seated.
All right, do the parties stipulate to the presence of the jury?
Yes, Your Honor.
Okay, it's my understanding the defense will call their next witness. Is that correct, sir?
Yes, Your Honor. The defense will call Dr. Angel Alcina via Zoom.
Sir, may I have you turn on your camera and raise your right hand?
Yeah, I'm trying to turn it, and it's not going.
All right, take your time.
Select another video camera in settings. Okay. Yeah, I'm not sure what's happening here.
That's all right, Dr. Alcina. Take your time. Do what you need to do.
Yeah, I'm not sure why you won't let me select the camera.
Worst case is if you need to re-log in, you can do that.
Okay, we can try that.
There we go. We see you now.
Okay, I'm right here.
May I have you raise your right hand? You do solemnly swear the testimony you are about to give in this action shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
May I have you state and spell your name for the record?
Angel Alcina, A-N-G-E-L-A-L-S-I-N-A.
Thank you.
Good morning, ladies and gentlemen of the jury. Good morning, Dr. Alcina. Can you hear me okay?
Yeah, I can. How about you? Can you hear me?
Yeah, we're getting a little bit of a delay, so I'm going to pause between my questions and hopefully the video feed will catch up. You are coming to us from Tampa, Florida, is that correct?
Yes, sir.
How's the power? Is it staying on?
Staying on today.
Okay. I'll let you know if we have any problems with the video or the audio glitching. But usually the longer we go on, the better it gets, not that we're going to be taking very long. Dr. Alcina, we have a presentation that I'm going to ask that our trial presenter put up, and then I'm going to start my questioning. Mr. Sanchez, can you put that up for us, please? Dr. Alcina, can you see the screen okay?
Yes, I can.
All right. Can you tell the jury a little bit about who you are?
Okay, I'm
Mr. Sanchez.
born and raised in Puerto Rico, and went to school in Boston and then trained. Actually went to medical school in my hometown in Ponce, and then went to train in Boston in surgery, general surgery and transplantation, and I did 9 years of postgraduate medical school training, including research. So from there, in '96, I came to Tampa General, which is a big hospital, big transplant hospital in Tampa, one of the largest transplant programs in the country now.
Dr.
I came in
Alcina,
'96.
can you move the microphone
Yes, sir.
closer to you? We're getting a bit of an echo.
Okay, how about now?
That's a little better, yeah. Please
Yes,
be close to the mic if you
a little
can.
slower. Maybe a little bit slower.
Yes.
So then, I got involved in organ transplantation, which is what I trained in Boston, liver, kidney, pancreas, and I became director subsequently, like in 2007, and did a lot of the things that, transplant surgeons and hepatic surgeons do. I did research, I trained in transplant fellows in transplantation. I did summer programs of research with end-stage liver disease, patients that were cirrhotics for years. I took care of about 1,500 liver transplant patients, maybe more from the other programs, followed them long-term, managed their medications, their immunosuppression. I took care of hundreds of patients with acute liver failure, was able to admit them, manage them with my team, and some of them got better, some of them were transplanted, some of them died. So I've seen a lot of those patients. I also, taught physicians in hepatology aspects because I always had a big interest in hepatology. So I taught hepatitis B, hepatitis C, NASH to many GI doctors and primary doctors in the community. And so I had that interest every time I used to go to meetings. I used to go to the Liver Society meetings and learn a lot about hepatology, and actually did a lot of my career in that. So I have that background in general surgery, transplant, cancer, because I also ran the liver cancer program in our hospital for many years. And I also did a lot of clinical trials. The clinical trials involved a variety of subjects, transplant medications, cancer, liver diseases, hepatitis, and things like that.
Dr. Alcina, we
That
had
pretty
some
much sums it
glitches.
up.
I don't know if you
Yes.
can hear me. We had some glitches in your statement, so let's try to break it down and do little short pieces so we can get a better, so we can hear on this end. We're having some difficulty.
Okay.
Let's start with, the first bullet point that you can see, and what I'm going to do is ask you about it. So you have 20 years of liver transplant experience. Can you tell the jury about that?
Well, that means that I was involved in the management of end-stage liver disease patients and following these patients post-transplant, and also transplanting the patients and being responsible for the outcomes of them. So, the surgeons basically a unique aspect that we're the ones that, that are basically responsible for their care and their outcome. The other things that are there are self-explanatory. I'm board certified in surgery. I'm a fellow of the Liver Society of Hepatologists, just like Dr. Hudson is. Dr. Hudson mentioned that 10% of the patients, 10% of the hepatologists belong to this distinction. Well, I do have the distinction as well as a surgeon, which is very unique. That's because I made contributions to the field of hepatology, and I was granted that particular designation. In the clinical trials has to do with the different aspects that are listed there. Acute liver failure was a particular interest. I studied every patient that had acute liver failure that had transplants in our program, and I followed them long-term, and I did long-term research on them, which is very unique to follow and try to describe what happened to these patients long-term. That hasn't really been done before. I was a hybrid, Mr.
We lost you
I was
again.
not
Hang on
a
one sec.
academic
We heard hybrid.
university. Yeah, so you know, I was a hospital-based physician that was able to do a lot of things in the academic world on my own with the resources that I had.
Dr. Alsina, we lost you there for a minute, so let's try and keep it short in terms of the sound bites until the internet improves. So we heard part of your answer. What I want to do is I want to go back and have you explain to the jury just the one bullet point about being a fellow with the American Association of the Study of Liver Diseases and a fellow of the American College of Surgeons. Can you explain what those two items are, please?
Okay, sure. I mean, I'm a pretty humble guy, Mr. Odu. A few years ago, I applied for fellowship to the Liver Society, which is composed of hepatologists. And there's only 8 surgeons that have that distinction among the society members. So, you know, that's something that I have that was given to me because I made contributions to the field and through the research that I had done and the different things that I met the requirements. That's what that means. It's pretty unique thing to have.
Dr. Alsina, please do whatever you can to be close to the microphone because when you sit back, it seems to be worse.
How about now, Mr. Odu? How about now?
Yeah, it's much better when you lean forward. I'm sorry, that's a little uncomfortable, but the microphone is.
Okay, no, we can do it this way.
So it's an honor to be chosen for the American Association Study of Liver Diseases and a fellow of the American College of Surgeons. Is that right?
To the Liver Society, Mr. Odu, because it's very rare for surgeons to have that.
Okay, and how long have you been part of the transplant program?
Since '96, I was until 2020. Then I moved to the VA. I'm in the VA system now, Mr. Odu. I work for the Veterans Administration System. I take care of veterans now in different aspects, surgical aspects, liver, cancer, administration, a lot of overseeing of many surgeons and many different things that I do now.
And that's part of the Veterans Administration hospital system?
Yes, I work with the VA, sir, full time.
And you take care of injured veterans, is that right?
That's all I do. I don't take care of any other patients except in the.
Unfortunately, we didn't get your answer. The internet connection dropped again.
Yes, I will leave full time.
And approximately how many transplant patients are you taking care of?
During the time that I was at Tampa General, about 1,500 from my team, and then about hundreds more from other programs. And then, so 1,500 we transplanted during those 20-something years.
I'm sorry, I didn't hear the very last thing you said. Can you repeat that, please?
1,500 during the time that I was there, Mr. Odu, 1,500 patients.
Okay. We're going to move on to the next slide. Can you tell us a little bit about the liver first?
Okay, so, you know, we don't have to start repeat a lot of the things that have been said, because, I mean, everybody's saying the same thing, but I think the important thing is for everybody to know that these patients were very sick with acute liver failure. But there was a, you know, there's a grading of them. Dr. you know, some of the doctors, Dr. Robin was describing the different phases, but, you know, some of these patients had hepatitis, some of them had order that he was talking about, and some of them had the encephalopathy, the confusional aspect of it. So those were the ones that were labeled as liver failure correctly. These patients were sick. These patients, some of them stayed in the hospitals where they were at. Some of them were transferred to transplant centers, and one of them was transplanted. So these patients were, you know, the ones that had mild hepatitis and recovered, they are different from the ones that were in the intensive care, that were serious. Those patients can be as sick as any other patient that anybody would encounter in a hospital. You know, if you want to describe a patient that is super sick to anybody in the medical world, you take an acute liver failure patient, and you'll tell them that those patients are teetering on the edge because they can go either way. They can get better, or they can suddenly get worse.
So as part of your review of the materials in this matter, did you look at the medical records of all of the plaintiffs, all of the adult plaintiffs?
Yes, all of them.
And did you reviewed all of those records?
Reviewed all the records, did extensive research on everything that the patients may have taken from the information that we had on records, and presented that to everybody in this case.
Okay. What I want to do is I want to focus in on the patients and how they're doing now, just to give the jury a preview of where we're going to go. And what I'd like to do is talk about each of the patients individually. Are you prepared to do that, Dr. Alsina?
Yes, sir.
Okay. Before we do that, can you tell us a little bit about your experience with patients with liver disease and recoveries? Can you give us an outline as to what's important in the care of a patient who's had a liver injury?
Well, I mean, my experience has to do with patients that came into the hospital with varying degrees of liver injury for which they needed our opinion, and anybody that has significant hepatic failure we knew about, and we would make decisions based on how the patients were doing, which is something that hasn't been discussed here, that is not just about biopsies or biopsies interpretations, it's about the clinical scenario of how the doctors that are taking care of those patients are going to proceed with the transplant or not, or whether they're going to manage them, you know, medically. A lot of the patients that have acute liver failure, there's no treatment for it. You're supporting them until the liver gets better or gets worse. In some of the conditions, we have treatments. Some of the patients that are here had something called mucomist or acetylcysteine, which was given to try to, you know, improve them. And there's evidence that it can improve patients. So, so my experience has to do with these patients before they get into trouble, or post-transplant, or during the transplant aspects, and how to select them. How to select them is very important because we only have so many hours to decide that in these acute cases, and it has to be done correctly, or you can end up transplanting a patient that does not need a transplant. So very tough decisions that are made quickly in this type of patients. This is not the classic patient that undergoes transplants. These are rare cases of acute liver failure. They're like 1 or 2% of the total transplants. So this is a unique scenario, and you have to have a lot of experience to be able to do this consistently, you know, because of the severity of how these patients deteriorate and how their systems begin to fail.
In terms of the care that these plaintiffs got, how was it generally?
Oh, the care of these patients, the care was good in the hospitals. I don't have any criticism. I mean, I would have noticed something from the rec. They needed to be transferred. Some of them were not transferred for different reasons. I know what the reasons were. There were insurance issues or whatever, but they were managed well. I mean, I don't have any issues with how they were taken care of. the hospitalists or GI doctors.
So you don't have any criticisms of the way any of the patients were taken care of? The computer glitched, and I want to make sure that we hear that answer.
Yeah, no criticism that I was able to observe, given.
And these people were very sick, correct?
Some of them were sicker than others, Mr. Odu. I'm not going to group patients here in totality. We're going to take each patient separately, and that's my method. Everybody has their own characteristics. Everybody was exposed to different things. Their body handled the hydrazine in different ways. So people were sicker. Some people were sicker than others.
Thank you, Dr. Alcina. Why don't we talk about the individual patients? Could you skip ahead, Mr. Sanchez, 2 slides to Mr. Hasselby? Dr. Alcina, can you see the slide for Sherry Rasmussen?
Yes, I can see it.
And what did you observe in studying her records?
Okay, so this is the only patient in the series that did not manifest the toxicity with a liver necrosis or liver, elevation. I tracked that were very serious, and so the liver was fatty on ultrasound when she came in, and then interestingly, this patient had an ultrasound 3 months later, and the ultrasound was different. Normal doesn't mean that that everything's normal. We're talking about ultrasounds. This is a gross test. It's just a different result, right? So we have to be careful making conclusions about how her liver is. I think her prognosis is good. This lady recovered. I don't have any new information on her, but she, this is data that's about 1.5 years old, and all I can tell you is that she recovered from the records that I reviewed.
Okay. And Dr. Hudson has recommended elastography for all of the plaintiffs, and we're not disputing that. Was the ultrasound that she had done, is that the same as elastography, or is that different?
No, the elastography is a stiffness test, Mr. Odus, liver stiffness measurement with particular techniques and measured in
We're not getting your answer,
something
Dr.
called
Alcina. Hang on 1 sec.
kilopascals. So it's a liver thing. It's a very specific test of liver stiffness, fibrosis. The ultrasound is just a regular sound wave test of the liver, like anybody else would get. So I don't have any issues with doing the stiffness test on these patients, Mr. Odu doing the elastographies. It's just that they have to be used when they're needed, because if some of these patients are having normal elastograms soon, then why would you keep doing them, or why, you have to have some sort of a clinical acumen there, how these tests are going to be used and what will be the usefulness for them. But they need to have biochemical markers for life.
So you don't have any concerns or criticisms about these plaintiffs having further care in the future, correct?
Not at all, sir.
Okay. And ultimately, what is Ms. Rasmussen's prognosis?
Well, it's good. I would have to see how she's doing now, Mr. Odu. The thing that has been missing here today is that the biopsies that have been discussed are a snapshot of what happened to these patients 3 or 4 years ago. And it would be very unlikely that if you do a biopsy now on these patients, the biopsy would be the same. That would be like impossible, that the biopsy would look exactly the same. So you have to have information to make prognosis and make decisions and present that information here. Her prognosis was good based on my review, based on what happened to her back then. But there's a lot of information that may be out there, and the information would have to come from biochemical tests or specific tests of the liver. None of these patients are going to undergo more biopsies, but they can undergo more non-invasive tests to see how their liver is doing. Did you get that, Mr. Odu?
No, we missed the first part, but I think what you
Okay.
said was that a biopsy is just a snapshot in time.
Yeah, I mean, it's a snapshot of something that occurred 3 or 4 years ago in these patients, and it's not gonna reflect what's happening now to the patients, whether it's for the better or for the worse. The biopsies, are part of the evaluation of the patient. It wasn't used to make big decisions clinically. The patients were managed clinically based on their
Now, we lost you again there. Can you repeat the very last thing you said, Dr.
Okay, I'm
Elson?
right here. That are managed, Mr. Odu, based on the clinical scenario that they presented. The patients were managed based on the clinical scenario of how they presented. That's what I was saying, not just based on a microscopic exam over their liver.
So you look at all the information when you have a patient. Is that what you're saying, Dr. Alsina? Again, the computer glitched and we didn't get it all.
Yeah, I mean, when you're managing these patients and you're gonna make decisions, whether it's back then in 2020 or now, you're looking at blood work, symptoms, how they're feeling, and you have to do very specific tests if you wanna know how that liver's doing.
Okay. Let's go on to the next slide. Daniel Taylor, what did you observe in your review of Mr. Taylor's medical records?
Okay, this patient had the onset of the injury 2 years before the outbreak, and the liver test normalized about 8 months later, and he has not had any biopsies or imaging for a long time. So, and then his prognosis is good as long as him or any of the other patients maintain the lifestyle that has been mentioned here. Some of these patients, and now we can talk in general, some of these patients have intrinsic risk factors that can be made better, and I think some of these patients will adopt a better. Can you hear me? Can you hear me, Mr. Olu?
No, you cut out again. That's why I raised my hand. I'll raise my hand when we can't hear you. So in
Okay, no,
terms
that's
of-
good. That's good. What I was saying is that these patients likely have adopted a healthier lifestyle, and their prognosis is going to be dictated based on that, and with the injury interplaying to some degree, but because some of these patients have risk factors that can be modified, lifestyles of weight reduction, control of hypertension, control of lipids, and diabetes. And 3 or 4 of the patients in this series had a combination of those risk factors. So if you can modify that, they will have a good prognosis, and I think that they will do that. I think that they're probably more aware now than they were before.
Okay, so I don't know if you heard Dr. Robin talk about the patients being good stewards, or Dr. Hudson talking about the patients being good stewards of the liver, diet, exercise, doing things that we should all do. Is that really what you're saying?
Yeah, I mean, the good steward, yeah, I don't know that. I did listen to the entire transcript of Dr. Hudson, but to answer your question, I mean, yeah, you have to have a little bit more awareness of the liver now, from now on these patients, and I think I would agree that you don't want to be ingesting any toxins, anything that can harm your liver, and try to avoid things that are not needed. A lot of patients take a lot of supplements, are very nutritional as acceptable, but they also have toxicity. So supplements are a double-edged sword in the world of herbal and supplemental injuries of the liver, and that's why they're called herbal and supplemental, HBS, as opposed to DILI, because they come from herbs. So the experts of the
Dr.
of
Alcina,
herbs.
let me stop you just because we're
Yeah.
not hearing about 80% of what you're saying.
Okay.
So let me just stop you there and let me see if we can summarize this so we can go to the next patient. Basically what you're saying is they should follow their doctor's recommendations as to their future care to take care of their liver. Is that what you were describing? We only heard part of it.
Well, I mean, I didn't use those words, but they have to have a good physician that will guide them and will help them modify these risk factors, Mr. Odu, right? So good internists that will help them because some of the patients have the particular conditions that need particular attention, and you have to have a good doctor that will help you navigate that. And so it's a patient issue and a physician issue. And if you do that correctly and you do good, then you're gonna be better in the long run.
All right, let's go on to, we have a typo, Gray Maynard. That should be Gray and not Greg.
Okay, so Mr. Maynard is a young gentleman, 39 years old, had 2 episodes of liver injury, and the liver function test normalized a month later. So there's no imaging, there are no biopsies, there's no other information that I have. So he recovered from that episode that he had back then. That's all I can tell you, Mr. Odu.
Okay, thank you. Let's talk about Mr. Henry.
Okay, Mr. Henry is a young gentleman, 24 years old, who had a different type of pathology, different radiologic findings, more chronicity, and underwent transplant at the at US. I didn't get to review a lot of his post-transplant records because they were not available, but he's here. I mean, he's 3 years post-transplant, I believe. Maybe more, and he's already overcome the early mortality of transplantation, which is good. So he's a transplant patient. He's not a patient like you and I. He's different. He's under the effects of anti-rejection drugs, and he has a lot of transplant implications that regular patients don't have. Many different consequences of transplant that he may encounter.
Dr. Alcina, we have a slide up for the jury about how transplant patients do after they've been transplanted. Can you see that?
Yeah, I can see that, but I don't know how applicable this is to him. This is a 5-year survival curve, Mr. Odu. First of all, it's
hang on one sec. We missed everything you just said. Hang on one sec and maybe it'll clear. Please start over. I'm sorry to interrupt you, Dr. Alcina, but we want to hear what you're saying.
Yes, this is, Mr. Odu, this is a 5-year survival curve of transplant patients that were in the pediatric population. This is not something that we're going to use a lot today. So,
Okay.
You see, transplant programs, they calculate patient survival at 1 or 3 years. That's it. The other data that we have long-term comes from other studies, not from registry studies of transplantation. So what does this say here? This says that at 5 years, 90% of the patients in this particular graph were alive, Mr. Odu. That's what this graph says, okay?
So 90% of the patients after 5 years post-transplant have survived.
Yeah, this is a pictorial view. We're not talking about Mr. Henry here. Let's just make sure that nobody gets confused here. But if you want to talk about 5-year survival, 90% of the patients in this graph would be alive at 5 years, and then they continue to live at the decaying rate that they're going to have. Okay, so that doesn't mean that they're only going to live 5 years. They're going to continue to live subsequently according to the slope of that curve that you see there that is very flat.
Do you in your practice take care of patients who have had a liver transplant more than 5 years ago, say 10, 15, 20 years or more?
10, 15, yes, all the time. You see, the other way to look at this, Mr. Odu, is to look at the median survival that we have talked about a lot already in the positions and Dr. Hudson. So the median survival is a bell-shaped curve, right? So everybody look at me here, bell-shaped curve. In the middle of the curve is 50%. So at what point are 50% of the patients dead or alive? That's what the median means, right?
Right. So your part,
So the patients that have reached the median, Mr. Odo. Did
we
you
can't
say
hear
something?
you again, I'm sorry, hang on one sec, you've cut out again.
Yeah, go back, Mr. Odo, go back to the previous slide.
Can you go back up one?
It's a,
Thanks.
Okay,
So
So-
what is the,
if you want to
you're
talk about
explaining the
median,
median, Dr. Alcina, wait one sec for me to ask the question. You're talking about the median lifespan, can you explain that to the jury, please?
at which 50% of the patients are either dead or alive. All right, so here's a bell-shaped curve, like a bell. In the middle is the year. And in the transplant, liver transplant scenario, the number for the median is 15 years when you take the patients from day 0 of transplant, okay? So if we take all the patients that we transplanted at day 0 and look at all of them long term, in 15 years, 50% are dead, 50% are alive. Now, one of the things that we have to clarify here is that it doesn't mean that the ones that have reached 15 years are dead, because half of them are going to continue to live at different rates. What are those rates? Well, the rates are depending on what were they transplanted for. Were they transplanted for cancer? Were they transplanted for hepatitis? Were they transplanted for alcohol disease? Were they transplanted for conditions that do well post-transplant? And what was their age? If they're young, they're going to do better than the people that were older, all right? So that's what the median survival is, means that 50% are dead, 50% are alive, and those that reach the median continue. We don't know where Mr. Henry is going to be, Mr. Odu. We cannot say that. We can just say that an average liver transplant patient has, if we take survivors of transplants at 6 months or a year later, the median survival increases a lot to about 7 more years because they've already overcome the mortality of the patient's early post-transplant. Were you able to hear me?
Yeah, we caught the very end of it. So what you're saying is the median takes into account all transplant patients, regardless of how sick they are, whether they have other comorbidities like cancer or something like that, and it just gives you an average lifespan.
Yeah. Right, but the investigators that have looked at long-term survival have broken it down by causes of liver disease, okay? So let me give you an example, Mr. Odu. I was reviewing a case the other day for a patient that had primary biliary cholangitis that was older. And those patients, when you give them a transplant, they live longer than patients of their same age in the general population. So it all depends on what you transplanted them for. If you transplant them for cancer, they're not going to do very well. If you transplant them for something that is not going to come back later, no alcohol issues, no hepatitis and things like that, then they're going to do better than those patients that have a potential recurrent disease. But there's no way to pinpoint Mr. Henry into a number here, Mr. Odu, because Mr. Henry could live 20 years or he could live only a week from now. You see, these statistics take all comers.
So it's just a statistic.
And if Mr. Henry were to die of an accident next week or have some misadventure, he would be an early mortality as opposed to a long one. Okay, so we don't know. We don't know where he's going to be, whether it's 15 years, 20, 5. We know it's not going to be 1 because he already overcame that mortality. But it could be anywhere in that spectrum. We just don't have a crystal ball.
Okay, so we expect Mr. Henry, though, because he's young, that gives him a better chance to do well. Is that what you're saying? Again, we're having trouble hearing.
Yes, better to do long-term because he's young and he can overcome problems as opposed to you trying to transplant a patient who's 70 years old that only is going to have so many years to live anyway. So, then the young people run into the other problem of if the livers fail or not, or if other things that pertain to the transplant, but they can also die of many things that they don't need any transplant for. So we should not just focus on the fact that he may need another transplant because that's unlikely compared to the other.
Hang on, Dr. Alsina, we're losing you again. Give it a second to catch
Okay.
up.
I'm here.
All right, I think we have you back. Can you please finish your answer? We didn't get the end of it.
Yes, what I was saying was that, I lost my train of thought. We have to remind me.
So we were talking about Mr. Henry and his long-term prognosis. Rather than looking at a statistic, we look at the patient. You were describing how long-term his prognosis could be because he's young, he follows his doctor's directions, that sort of thing. And you're frozen.
Yeah, if he as a transplant patient, Mr. Odu, if he follows the doctors and the good regimen of a transplant patient, he has an edge over somebody that will not do it for sure, because that's known to everybody who's involved in transplantation, that patients that don't follow instructions, don't take their medications well, are not going to do well with this.
So if he follows his medication, again, we lost most of your answer. Can you sum it up for us shortly?
The transplant patient has to particularly adhere to the transplant regimen very, very meticulously, Mr. Odu.
So he should follow his regimen meticulously, was that what you said?
Right.
Okay. Thank you, Dr. Alsina. Again, I apologize to you and the jury for the glitches. For some reason, we didn't have this the other day, and we haven't had this previously in depositions, but we're having a pretty bad glitch. So we're going to try and keep the answers short, and then that way, if we miss something, I can ask you to repeat it. So
Sure.
Let's move on to our next plaintiff, Brandy Wren. Dr. Alsina, can you give us a synopsis of your opinions of Brandy Wren?
Right. Brandy Wren had sustained acute liver failure during the time period of the hydrazine toxicity, November of 2020, and by the next month her liver test had normalized, and she did have a biopsy which has been described here today already many times. So that's information that I have. She recovered from the acute injury, and that's what I can tell you.
All right, thank you, Dr. Alsina. Let's go on to the next patient, Mr. Muntz. Can you give us a synopsis,
Mr.
Mr. Muntz?
Mr. Muniz sustained acute liver failure and was transferred to UCLA, and he improved there. He improved while they were watching him, evaluating him for a potential transplant. He was not listed, and there's no, since July of 2018, I don't have any other information on him, but he got better back then.
Okay, so he hasn't treated since July of 2018. Is that the information that you have?
No, that's not what I said. That's the information that I was given. I don't know. That's a long time ago. That's 6 years ago.
Right.
I'm sure he's had plenty of other follow-up since.
Okay, so the last information you had was when he treated in May of 2018, correct?
Correct.
Okay, let's go on to Mr. Link.
Mr. Linky sustained.
I'm sorry, Dr. Alsina, you're going to have to start over. We didn't hear you.
Linky sustained an acute liver injury and also had encephalopathy, and his tests normalized 3 months later, but then he did have a Well, in January of 2022, about 2 months later, he did have an elevated ALT of 80, close to a COVID episode. And I have not seen any new information on him in 3 years.
Okay. Let's go on to Mr. Ita. Can you give us a synopsis of your opinion of Mr.
Ita, he sustained an acute liver failure during the outbreak of real water. His test normalized 4 months later, and he did have a normal liver ultrasound that month in March of 2021. He did have a biopsy that did not show fibrosis. So he did have that recovery of the acute injury.
All right. Let's go on to Mr. Brown. Can you give us a synopsis of your opinion of Mr. Brown?
Mr. Brown is a 41-year-old gentleman that also sustained the injury.
We didn't hear you, Dr. Alsina. Can you say that again? I'm sorry.
He also sustained the injury during November of 2020. And by the next month, in December, his liver tests were showing improvement, and he never had a biopsy.
Thank you, Dr. Alsina. Can we go to the next plaintiff, Ms. Moreno?
Carla Moreno is a 30-year-old female who also had the onset of the hepatitis in November of 2020, and had a clotting disorder, had the acute liver injury. By the next month, in December, her liver test had normalized, and she had 30% fatty change in her liver, steatosis, fatty change that we've described here today. And the next year, in April of 2021, she still had a fatty liver on ultrasound. And that's information that I have on her.
Okay. Let's go on to Ms. Monica Branch-Noto.
Monica Branch-Noto had the onset of the injury in December of 2020, had acute liver failure. Her test normalized like 7 months later in 2021, and she did have a biopsy back then in December of 2020 when she presented to the hospital that showed a lot of fat, 30% fat, macrovesicular fat, and focal bridging fibrosis. Hey, Mr. Odu?
Yeah, I was just waiting for the computer to catch up to us.
Yes.
All right. Let's go on to the next plaintiff, please. Pamela Brown.
Pamela Brown is a 75-year-old female that also sustained the injury during the outbreak, had an acute liver injury. Her liver test became normal later that month and remained normal until August of 2022. And she had an ultrasound back then in November during the episode of the illness that showed that her liver was sort of normal by ultrasound, and so was her CAT scan. But those are imaging tests that are not very accurate, but they were not abnormal, let's put it that way.
Okay, so her imaging tests were not abnormal?
They were not abnormal, they're just,
I'm sorry, we didn't get your
imaging
answer.
of her liver, they're
Dr.
not
Alsina,
microscopic.
we didn't get your answer. There was a glitch again. What was your answer about?
Yeah, they're not, they're just imaging tests, Mr. Odo. They're not microscopic tests of her liver, of the architecture or structure.
Did you get that?
They were imaging tests of the liver, not the
I can repeat it, Mr. Odo.
I'm sorry, I didn't understand what you said just now because again,
Yes.
the computer glitched out.
The tests are not representations of the architecture or structure of the liver. They're just imaging tests.
Okay. Let's go to the next patient. Can you give us a synopsis of your opinions of Stephen Watkins, please?
Mr. Watkins sustained the injury in May of 2018, about a year before the outbreak. He did have an acute liver injury. And by the next year, his liver test had normalized. Except that in May of 2022, he did have an elevated ALT of 77. And his ultrasound showed a fatty liver back then.
And you treat patients with fatty liver? Can you hear me, Dr. Alsina?
Yeah, I mean, I see patients with fatty liver all the time. Mr. Odu, 1 out of 5 people in this country have fatty livers, okay? 1 out of 5 people in this country have fatty liver. It's one of the largest epidemics based on obesity and the other risk factors that we've been talking about.
Okay, thank you very much. Let's go on to the last one, Daisy Wee.
Daisy Wee she sustained acute liver failure in June of 2020, and by September her liver test had normalized, and she had fatty changes on ultrasound, and she had the biopsies that were described here today, 2 biopsies that have already been described well, the second one slightly better than the first one. So she does have some fibrosis in that biopsy, but that was 4 years ago. We don't know exactly how her liver has healed, or exactly the architecture of that liver now.
Dr. Alsina, thank you again. I'm sorry that we had so many technical difficulties today. Were all of the opinions that you gave us today to a reasonable degree of medical certainty?
Yes, sir.
Thank you so much.
Thank you, sir. Mr. Parker,
What's the court's pleasure, Your Honor?
we can approach. Mr. Parker.
Thank you, Your Honor, I appreciate that. Grab this stuff. Tori, do we have the deposition of Dr. Alsina by you?
Yes. Am I publishing this?
Not yet. We may not need it. I just want to make sure we do have it.
I do have it.
Good morning, ladies and gentlemen. We only have a couple minutes left. Good morning. Good morning. Dr. Alsina, nice to see you again. How are you?
I'm great, Mr. Parker. Thank you. I hope you're doing well.
I am. Thanks for asking. Dr. Alsina, I don't believe I'll be very long. Hopefully we can get through this in the next 10 or 15 minutes, okay?
Yes.
All right. Dr. Alsina, I believe you testified during your deposition that Mr. Taquante Henry's life will be shortened, certainly, and the medium time or half-life is 14 years. And the reason I bring that up is because I think you said 15 today, but I think in your report you said 14. Is that correct?
I think 14 is fine. 14 is okay for the median survival, Mr. Parker, for patients that are, for analysis that are taking all comers of transplant. He's already survived 3 years, so you have to give him the edge of him overcoming that 7% mortality the first year. Regardless of that, he's not going to live a particular time period because you and I don't have a crystal ball of how long he's going to live. But his life expectancy is shorter than for somebody who's 24 years old, Mr. Parker.
And that's because of hydrazine in the real water, correct?
Well, because of the transplant.
I'm sorry.
Because the hydrazine, caused the transplant.
Got it.
Because the hydrazine necessitated the transplant, and because he's a transplant patient, he's shorter now. He has a shorter life expectancy.
Okay, I think we caught most of what you said, Dr. Alsina. Dr. Alsina, the reasons you discussed in your deposition in terms of what typically happens with a liver transplant patient that causes their early death, I think you gave me several reasons. I'm going to name them and tell me if you agree. I think that would be an easier way than having you go and perhaps having the problems with the reception, okay?
Sure, yes.
One of the reasons you said is renal disease or kidney failure, is that correct?
Yes.
Cardiovascular disease?
It goes up in frequency, yes.
Colorectal cancer?
all cancers increase in frequency, Mr. Parker, all of them.
All cancers, that would be skin
Pretty much.
cancer, every cancer you can think of.
Skin being the most common, but the other ones increase in frequency to some degree compared to like you and me.
Yes, sir. They also die because of the anti-rejection medications can lead to diabetes, is that correct?
Yes, it can.
And they also are more prone to die because of hypertension, correct?
Yes, some of the drugs cause hypertension.
All right. Now, Dr. Alsina, when I took your deposition, I believe you said you were not aware of the article dealing with the Air Force service person who had less than 1 minute of exposure to hydrazine and ultimately had experienced symptomology. Do you remember that article that I discussed with you during your deposition?
Right, but I saw it, I remember, Mr. Parker, but I saw the reference in the transcript from Dr. Hudson
Okay, perfect.
at this trial, right?
Okay.
So, I mean, I'm gonna testify to things that I was given and that I had available to me. I will not hide information from you that I found. I found that yesterday when I was reading the transcript, and I noticed that there was an F-16 fighter that was exposed to the propellant, and it was in 1971 article. So I may have missed it because it's so long ago, 50 years ago, that I never found the reference, but it's there.
Hey, Dr. Alsina, I'm not being critical. I'm just reminding you of that article. Okay?
Right, but what I'm saying is that I did not miss any evidence. I know that the article is there. It wasn't there available to me for me.
Okay, so Dr. Alsina, let me just help a little bit. The Air Force service person, that was a 2011 article. The machinist who ultimately died from exposure to hydrazine, that was a 1971 article. Does that help refresh your recollection of the two articles?
I'm from reading the transcript yesterday. I'm remembering more the 71, but I believe you that there's another article and another case.
All right. And you indicated, based upon the biopsies that you are familiar with in this case, that several of the biopsies showed some form of fibrosis, correct? In these
Right.
patients. And then several of the biopsies also showed fatty liver in several of these patients, correct?
Yes.
And we know that of the 4 Loma Linda biopsies, 3 of the 4 showed fibrosis, and in addition to that, in a few of them, or 2 of them I believe, bridging fibrosis, correct?
Yes, I mean, I don't know the Loma Linda, I'm not sure, but if you say that they had fibrosis, I take your word.
All right. The point being is, in every one that was biopsied, with the exception of 1 or 2 of the 10 biopsies that we're aware of, some form of fibrosis or fatty liver was discovered, correct?
Yes, but I only reviewed 6 patients that had biopsies in this series, just to clarify, Mr. Parker.
Understood, Dr. Alsina. And what I believe you have testified to today is that because we do not have recent biopsies on all 15 of the plaintiffs here, you can't say to a reasonable degree of medical probability or certainty their current condition of their livers, correct?
Correct, yes.
Thank you. What you can say, and I don't know if you heard Dr. Robin a few moments ago, you can say that each one of these plaintiffs are now more susceptible to liver injury than they were before drinking real water that contained hydrazine. Correct, sir?
Yes, Mr. Parker, if they have something structurally there, if they have the problems and they have something structural and fibrosis or something that remains in that liver, then they will be more susceptible, and then you're dealing with potential response to new insults and immune issues that the liver may convey.
And that's because we know that hydrazine is a known liver toxin, correct?
Yes, sir.
No further questions, thank you.
Thank you. Mr. O'Do, anything else?
Very briefly. Dr. Alsina, does the liver recover from injuries when it's exposed to a toxin?
Yeah, to toxins or drugs or hepatitis or okay, are you still there?
Yeah. Does the internet connection get worse when we put the slideshow up? Because I can take that down.
No, it just sort of surprised me. I mean, we know that it can recover from treatments of hepatitis, treatments of different toxins. Hepatitis being the classic example, the hepatitis B and C, that it can improve. And patients that have alcohol disease and sustained alcoholic hepatitis, their livers can improve, they can lose their jaundice, their livers can recover. So we've seen patients that were sort of in the border of death because of toxins, and they can improve. But they're going to have different structural problems in their liver, but clinically they can improve.
Dr. Alsina, can you see the last bullet point on this slide about what happens to the liver when the toxin or the insult is removed? And can you explain that to the jury, please?
Well, that's a general concept, Mr. Odu. That means that, I mean, if you have a toxin that you were exposed to, okay, if these patients were given a toxin while they were hospitalized, they would continue to sustain injuries. The most common cause of injuries is drugs, right? Antibiotics and things like that. So if you give a patient the antibiotic that led to their liver injury and don't stop it, the patient's going to get worse. So the reason why these patients get better is because you've withdrawn the drug inciting event, whether it's Tylenol or Augmentin or whatever you gave the patient. That's a general concept of drug-induced injuries, is that when you remove it, you can improve or you can get worse. You don't stay the same. You either go one way or the other.
So if it's a drug-induced or toxic liver injury and you remove whatever is causing that injury, as a general proposition, if the liver can recover, it will.
Yes, but some patients don't get better because the injury is overwhelming and they can head the other way. So not everybody that has a drug-induced injury or herb injury is going to get better.
And
Some of them fail, Mr. Odu. There's a subgroup of people that will get worse.
some people get worse, some people
It's how
get
your
better.
body-
I can't hear you, Dr. Alcini. You gotta wait for me to ask the question, please. When you remove the insult that is causing the liver injury, as a general proposition, were you saying people get better? I could not hear you. I'm sorry.
Yeah, I mean, but not everybody's going to get better, Mr. Odu. That's what I was trying to say, that when you have common drugs like Augmentin, drugs for tuberculosis that can cause liver injuries in high rates, some people, when you withdraw the drug, do not get better and they get worse.
In this
So
case, the toxin was,
what you're saying is a general concept. It's just not 100% true all the time.
nothing in life is 100%, Dr. Alcina. Can I ask you this question? These plaintiffs were injured from drinking real water that had hydrazine in it. That toxin is now being taken away. They're not going to drink real water anymore. It's been recalled. So they should get better, correct?
Well, they should have gotten better by now. I mean, this happened 3-4 years ago, so you know, they should have improved by now because it was removed. There should not be an ongoing injury. I would say that there should not be an ongoing injury because they're not exposed to the hydrazine.
Thank you, Dr. Alcina.
Okay,
Yes,
thank
sir.
you,
Dr. Alcina? Can you hear me?
I'm right here, sir.
Oh, perfect.
Yes.
I understood the general proposition point you just made. And I think your response was, not everybody gets better, some may get worse. Is that what you said?
Yeah, I think he was putting it in the context of the acute event, and when you withdraw the toxin, that things improve. So I was making the point that that doesn't happen all the time.
And I want to distinguish between symptomology and permanent injury. Okay, Dr. Hudson? Dr. Alcina?
Yes.
You understand that there's a difference, correct?
Yeah, symptoms of liver disease would be very severe if the patients start to sustain symptoms now, Mr. Parker, like anything, you know, related to swelling or jaundice or confusion. That would be concerning, but otherwise, you would have to detect things in some other way.
Exactly, which means these plaintiffs may look fine sitting here today because they don't have the jaundice or the symptomology, but they could have sustained permanent injuries to their liver. Isn't that correct?
That's correct. I just don't think that, they should be scared that they're gonna lose their livers, because that doesn't do them any favor. I think that they should live their lives healthy and with good follow-up, and with these things that happen to them, they more likely that they're gonna be okay. But, you know, they may not have the normal liver, Mr. Parker, but I think that they should be, you know, we should not tell them that they're gonna need transplants or things like that. That's not really true.
Well, we hope they won't need them, but sitting here...
Yeah, I don't, yeah.
No further questions. Thank you so much, Dr. Alcina. Thank you, Your Honor.
Yeah, thank you, Mr. Parker.
Still do. All right, thank you, doctor.
Thank you, Judge.
And no jury questions, right? No jury questions for the record. Okay, ladies and gentlemen, it's time for lunch.
You can sign off, Dr. Alcina.
Yeah, time for lunch. All right, you're admonished not to converse amongst yourselves or with anyone else on any subject connected with this trial, or to read, watch, or listen to any report or have a commentary on the trial by any persons connected with this case, or by any medium of information, including without limitations, newspaper, television, radio, social media. Remember that prohibition, and last but not least, do not form or express any opinion on any subject connected with the trial until the cause is finally submitted to you. And we'll take hour 15. Okay, and also, I think lunch is ready.
Yes.
Lunch is here, I should say.
I don't think we notified the jury though. I don't think we let them know that was happening.
Well, okay.
All rise to depart, jury. Jury's clear, please proceed.
All right. And for the record, the defense has no additional witnesses.
That's correct, Your Honor.
Yeah, remind me to ask you the rest in front of the
We
jury.
will do that, Your Honor.
All right, and everyone enjoy your lunch.
Thank you, Your Honor.
Thank you, Your Honor.
Department 61, now come back to order. Please proceed. Thank you.
All right, good afternoon to everyone. Now let's go ahead and set forth our appearances on the record.
Good afternoon, Your Honor. Eric Pepperman, Will Kemp, Eddie Parker, and Brianna Swiss are the plaintiffs.
Good afternoon, Your Honor. Joel Adu, Matthew Kaufman, and Eric Freeman on behalf of the Real Water defendants.
All right, Do we have anything we need to address outside of presence?
Your Honor, I think we do. The defense is going to rest, real water's going to rest, but I think Mr. Freeman has a motion that he would like to
Okay.
argue, and it's more convenient for the court. He can do it now rather than bring the jury in rest and then do it.
Let's go ahead and do it now. Sir?
I'll be brief, thank you, Your Honor. We move for a motion for, as a matter of law, as to plaintiff Stephen Watkins under Rule 50. Defendants are entitled to a judgment as a matter of law as to Mr. Watkins' claim because it was asserted outside the statute of limitations. The case, Wynn versus Sunrise Hospital, states that statute of limitations begins to run when plaintiff is put on notice. And this is when he should have known the facts that would lead an ordinarily prudent person to investigate the matter further. The standard is that, excuse me, the standard is that plaintiff just needs general belief to be generally aware of a claim. Mr. Watkins was on notice by June of 2018, and he did not file his lawsuit until March of 2021, which is after the statute ran. Mr. Watkins has testified in deposition, in other trials, and in this courtroom last Thursday that the doctor at the hospital told him to stop drinking real water. He also testified Thursday that he brought this to the attention of Real Water in that his wife sent an email to Real Water that Mr. Watkins was in the hospital and doctors told him to quit drinking alkaline water. Plaintiffs claim that the email put Real Water on notice, and that's because Mr. Watkins was on notice himself. And we don't believe Mr. Watkins' case should go to the jury, and as such we move for a judgment as a matter of law under NRCP 50. Thank you.
Thank you, sir.
Yeah, Judge, I would just incorporate what we said, the summary judgment opposition. And I'd also point out that there was a new case given up from the Supreme Court after that, Mr. Henriott's case involving the Government Center. And I would submit, and that's the Atkins versus Union Pacific case, I would submit that the initial briefing of that case is pretty much dispositive on this issue. So Your Honor, I'll rest on that.
All right. And the moving party gets the last word.
Nothing further, Your Honor.
All right. As far as the Rule 50 motion, as it relates to the statute of limitations issue in this matter, I'm going to deny it. And I mean, for the very reasons I set forth in my decision as far as the summary judgment motion. As far as the Atkins matter or Atkins case, I haven't read that. But I would anticipate Mr. Henriott, who I know, probably did a pretty good job in setting forth what the appropriate standard would be as far as knowledge would be concerned. Anyway, anything else?
One more thing. Based on your denial of the motion, we ask that we add a special interrogatory for the jury on the jury verdict form to ask a simple question. Did Stephen Watkins know Real Water caused his liver injury by June of 2018?
Judge, I think that should have been tendered a couple days ago. Tendering the right for closing argument is probably not appropriate.
All right. Anything else on that issue?
Only that it didn't become relevant until you denied the Rule 50 motion.
Here's my question. I mean, we're talking about a special verdict form, but wouldn't I need more than that?
Yes, Your Honor, there'd have to be appropriate jury instructions. There'd have to be a change to the special verdict form. The instructions were not tendered, the verdict form was agreed to. It's just too late.
I mean, I do think, I mean, I would have to have statute of limitations, jury instructions, maybe a series, knew, should have known, and all those things. And I guess there would have to be, whatever the current status of the law in the Atkins case, I might have to take language from that case, right? In order to articulate what the appropriate jury instruction would be, because it's my job to charge the jury on the law in this case. It really and truly is. This is what I'm going to do, and this will obviously be an appellate issue, and that's okay. I feel that if we were going to pursue that specific issue, a couple of things should have happened before now. And that would be, number one, making sure that I knew this was going to be a question of fact to be presented to the jury. Secondly, tender the appropriate jury instruction. And then couple that with the verdict forms. And I mean, I'll be candid with everyone. It could take me a day to go through all that and do the appropriate analysis, because I don't mind saying it. I'm going to read all the cases. Everyone knows I'm going to take a deep dive, read the cases, see what Mr. Henriot convinced our Nevada Supreme Court of in the Atkins versus, is it versus Union?
Union Pacific.
Union Pacific, yeah. And I would set forth on the record the reason set forth in that case. But it's teed up, it's perfected. That's all that really matters at this point. Anything else? Excuse me.
Your Honor, just briefly, one housekeeping issue. Plaintiff's Exhibit 272, we have a stipulation to admit that exhibit.
Is it stipulated?
Yes, Your Honor.
Shall be admitted. Anything else from anyone? All right. Are we ready? Do you have the jury? No, you keep that. And for the record, I've been handed, I guess, proposed jury instructions. It appears to me 1 through 29. Of course, subject to any objections noted on the record, do we agree to those instructions?
There are no objections to the compensatory phase jury instructions, Your Honor.
Okay, and what are those?
I'm sorry, Your Honor, I didn't hear you.
No, you said there are?
There are none.
Oh, okay, I got you. All right. And from the plaintiff, any?
No, Your Honor.
Just want to make sure. So, are we ready to bring the jury in? Anything else?
Yes, Your Honor.
Yes, Your Honor, we're ready.
Okay, Mr. Marshall. So how many actual trial days have we had?
10. This is day 10, Your Honor. Sorry.
No, I get it. That's amazing. How many did we do last time? Trial days.
It was 13, Your Honor.
So you think if we have to go in February, we can do it in a week?
That's even 4 days.
Right? How many plaintiffs do we have in that one?
That's 13.
Okay, so a similar number. I'll take 2-to-1 odds if we go to trial in February. That's what I think.
You're right.
I don't have any after that, do
No, Your Honor.
Full rest of the jury? You too. Thank you.
All right, do the parties stipulate to the presence of the jury?
Yes, Your Honor.
Mr. Marshall, can you approach, please? Real quick.
Yes, Your Honor.
And counsel, thank you for your assistance. All right. And so, for the record, does the defense call their next witness or do they arrest?
Your Honor, at this time, the defense rests.
Okay, thank you, sir.
Thank you, Your Honor.
All right, ladies and gentlemen, I just want to bring you up to date as to where we're at as far as testimony is concerned. The plaintiff has finished their case in chief, remember we talked about that. And after the plaintiff's case in chief, the defense case in chief starts and they finish theirs. And so you know where that puts us, right? We're going to, at this time, I'm going to read to you the jury instructions on what the law is in this case. And just as important too, as far as the jury instructions are concerned, it also sets forth in the instructions what your duties and responsibilities will be as a jury deliberating in this case, you understand? And very, very important. Now, a couple of things that are important to remember as far as jury instructions are concerned. You can take notes if you want to, but you'll be given copies of the jury instructions as I read into the record to have with you in jury deliberations, you understand that? So you have them with you. And also, some of the instructions are long and complicated, some aren't especially complicated, and some are very clear. Remember at the very outset we talked about certain issues that might arise, and sometimes the jury will have a question. Remember I talked about that? And I say 75–80% of the time the response to the question would be what? Read the jury instructions, right? Because they're so important as far as what your role and responsibility is concerned. And so subject to any objections we've had in this case, are counsel familiar with and approve the proposed jury instructions?
Yes, Your Honor. Yes, Your Honor.
And for the record, I think that's 1 through 29. Does that sound about right?
Yes, Your Honor.
Okay. And as far as the verdict forms, subject to any objection that's already been made on the record, are counsel familiar with and approve of the proposed verdict forms?
Yes, Your Honor. Yes, Your Honor.
Okay. All right. And so, ladies and gentlemen, once I finish reading the jury instructions, after that's concluded, then we go to closing argument. And essentially what will happen there is the parties will be given a chance to review with you not only the evidence, but also the instructions and the law in this case, and make recommendations with you as far as how you should interpret the evidence and what potentially your verdict should be. Do you understand? All right. Jury instruction number 1. Ladies and gentlemen of the jury, it is my duty as judge to instruct you in the law that applies to this case. It is your duty as jurors to follow these instructions and to apply the rules of law to the facts as you find them from the evidence. You must not be concerned with the wisdom of any rule of law stated in these instructions, regardless of any opinion you might have as what the law ought to be. It would be a violation of your oath to base a verdict upon any other view of the law than that given in the instructions of the court. Jury instruction number 2. In these instructions in verdict form, defendants, AffinityLifestyles.com Inc., a Nevada corporation, DBA Real Water, and Real Water Inc., a Delaware corporation, shall be collectively referred to as Real Water. Jury instruction number 3. If in these instructions any rule, direction, or idea is repeated or stated in different ways, no emphasis therein is intended by me and none may be inferred by you. For that reason, you're not to single out any certain sentence or individual point or instruction and ignore the others. But you are to consider all of the instructions as a whole and regard each in light of all the others. The order in which the instructions are given has no significance as to their relative importance. Instruction number 4. One or more of the parties in this case is a corporation. A corporation is entitled to the same fair and unprejudiced treatment as an individual would be under like circumstances. And you should decide the case with the same impartiality you would use in deciding a case between individuals. Instruction number 5. The masculine form is used in these instructions, if applicable, as shown by the text of the instruction, and the evidence applies to a female person or a corporation. Instruction number 6. Although you are to consider only the evidence in this case in reaching a verdict, you must bring to the consideration of the evidence your everyday common sense and judgment as reasonable men and women. Thus, you're not limited solely to what you see and hear as witnesses testify. You may draw reasonable inferences from the evidence which you feel are justified in light of common experience, keeping in mind that such inferences should not be based on speculation or guess. A verdict may never be influenced by sympathy, prejudice, or public opinion. Your decision should be the product of sincere judgment and sound discretion in accordance with these rules of law. Instruction number 7. If during this trial I have said or done anything which has suggested to you that I am inclined to favor the claims or positions of any party, you will not be influenced by any such suggestion. I have not expressed nor intended to express, nor have I intended to intimate any opinion as to which witnesses are or are not worthy of belief, what facts are or are not established, or what inferences you should draw from the evidence. If any expression of mine has seemed to indicate an opinion relating to any of these matters, I instruct you to disregard it. Instruction number 8. The evidence which you are to consider in this case consists of the testimony of the witnesses, the exhibits, and any facts admitted or agreed to by counsel. Statements, arguments, and opinions of counsel are not evidence in the case. However, if attorneys stipulate as to the existence of a fact, you must accept the stipulation as evidence and regard the fact as proved. You must not speculate to be true any insinuations suggested by a question asked a witness. A question is not evidence and may be considered only as it supplies meaning to the answer. You must disregard any evidence to which an objection was sustained by the court and any evidence order stricken by the court. Anything you may have seen or heard outside of the courtroom is not evidence and must also be disregarded. Instruction number 9. You must decide all the questions of fact in this case from the evidence received in the trial and not from any other source. You must not make any independent investigation of the facts or the law or consider or discuss facts as to which there is no evidence. This means, for example, you must not on your own visit the scene, conduct experiments, or consult reference works for additional information. Jury instruction number 10. There are 2 kinds of evidence, direct and circumstantial. Direct evidence is direct proof of a fact, such as the testimony of an eyewitness. Circumstantial evidence is indirect evidence, that is, proof of a chain of facts from which you could find that another fact exists, even though it has not been proved directly. You're entitled to consider both kinds of evidence. The law permits you to give equal weight to both, but it is for you to decide how much weight to give any evidence. It is for you to decide whether a fact has been proved by circumstantial evidence. Instruction number 11. In determining whether any proposition has been proved, you should consider all of the evidence bearing on the question without regard to which party produced it. Instruction number 12. If counsel for the parties have stipulated any fact, you will regard that fact as being conclusively proved as to the party or parties making the stipulation. Instruction number 13. Certain testimony has been read in evidence from a deposition and/or shown by video. A deposition is testimony taken under oath before trial and preserved in writing. You are to consider that testimony as if it had been given in court. Instruction number 14. When a party to a lawsuit is a corporation, the other party may schedule a deposition under the Nevada Rules of Civil Procedure, 30B6, requiring the corporation to designate one or more officers, directors, managing agents, or representatives to testify on its behalf on matters known or reasonably available to the corporation. The person so designated shall testify as to matters known or readily or reasonably available to the organization. The testimony of the Rule 30B6 designee is binding on the corporation. Instruction number 15. The credibility or believability of a witness should be determined by his or her manner upon the stand, his or her relationship to the parties, his or her fears, motives, interests, or feelings, his or her opportunity to have observed the matter to which he or she testified, the reasonableness of his or her statements, and the strengths or weaknesses of his or her recollections. If you believe that a witness has lied about any material fact in the case, you may disregard the entire testimony of that witness, or any portion of this testimony which is not proved by other evidence. Instruction number 16. An attorney has a right to interview a witness for the purpose of learning what testimony the witness will give. The fact that the witness has talked to an attorney and told him what he would testify to does not, by itself, reflect adversely on the truth of the testimony of the witness. Instruction number 17. A person who has special knowledge, skill, experience, training, or education in a particular science, profession, or occupation may give his or her opinion as an expert as to any matter in which he or she is skilled. In determining the weight to be given to such an opinion, you should consider the qualifications and credibility of the expert and the reasons given for his or her opinion. You are not bound by such an opinion. Give it the weight, if any, to which you deem it entitled. Instruction number 18. The lawyers and witnesses have shown you charts and summaries to help explain the facts. The charts or summaries themselves, however, are not evidence of any proof or proof of any fact. Charts and summaries are only as good as the underlying evidence that supports them. You should therefore give them only such weight as you think the underlying evidence deserves. Instruction number 19. Whenever in these instructions I state the burden or burden of proof rests upon a certain party to prove a certain allegation made by him, the meaning of such an instruction is this: that unless the truth of the allegation is proved by a preponderance of the evidence, you shall find the same to be not true. The term preponderance of the evidence means such evidence as, when weighed with that opposed to it, has more convincing force, and from which it appears that the greater probability of truth lies therein. Instruction number 20. Plaintiffs assert claims for strict liability for a defective product. Real Water has admitted that the Real Water product that it manufactured was defective and unreasonably dangerous. Real Water has also admitted that its defective product caused injuries asserted by each plaintiff. Thus, The only issue remaining to be determined by you are, 1, the amount of compensation that should be awarded to each plaintiff, and 2, whether Real Water is liable for punitive damages. Instruction number 21. You must award damages for each plaintiff. In determining the amount of losses suffered by each plaintiff, you will take into consideration the nature, extent, and duration of injuries or damages you believe from the evidence that each plaintiff has sustained. And you will decide upon a sum of money sufficient to reasonably and fairly compensate each plaintiff for the following: the physical and mental pain, suffering, anguish, disability, disfigurement, permanent injury, and loss of enjoyment of life endured by each plaintiff from the date of his or her injury to the present, the physical and mental pain, suffering, anguish, disability, and loss of enjoyment of life which you believe each plaintiff is reasonably certain to experience in the future as a result of his or her injuries. The court has only determined the past and future medical expenses for each plaintiff as a result of his or her injuries. Therefore, you should not include past or future medical expenses in your damage awards to each plaintiff. For plaintiff Taquante Henry only, damages for his shortened life expectancy. Jury instruction number 22. No definite standard or method of calculation is prescribed by law by which to fix reasonable compensation for pain and suffering, nor is the opinion of any witness required as to the amount of such reasonable compensation. Furthermore, the argument of counsel as to the amount of damages is not evidence of reasonable compensation. In making an award for pain and suffering, you shall exercise your authority with calm and reasonable judgment, and the amounts you have fixed shall be just and reasonable in light of the evidence. Jury instruction number 23. According to the U.S. Department of Health and Human Services standard mortality table, the life expectancy of a male person aged 25 is 45 years. This fact should be considered by you in arriving at the amount of damages to award plaintiff Taquante Henry. Life expectancy shown by the mortality table is an estimate of the probably average remaining length of life for all persons in our country of a given age, and it is for you to determine the probable life expectancy of plaintiff from the evidence, in this case, taking into consideration all of the evidence bearing on the same issue. Instruction number 24. Whether any of these elements of damages have been proven by the evidence is for you to determine. Neither sympathy nor speculation is a proper basis for determining damages. However, absolute certainty as to the damages is not required. It is only required that plaintiff prove each item of damage by a preponderance of the evidence. Instruction number 25. You may consider whether you should award punitive damages or exemplary damages against Real Water. Punitive or exemplary damages are to make an example of or punish wrongful conduct. You may, in your discretion, award such damages if, but only if, you find by clear and convincing evidence that the defendants were guilty of oppression, fraud, or malice, express or implied, in the conduct providing the basis for liability. Oppression means despicable conduct that subjects a person to cruel and unjust hardship with a conscious disregard of the rights of the person. Fraud means an intentional misrepresentation, deception, or concealment of a material fact known to the person with the intent to deprive another of his or her rights or property, or to otherwise injure another person. Implied malice means despicable conduct engaged in with a conscious disregard for the rights or safety of others. Conscious disregard means the knowledge of a probable harmful consequence of a wrongful act and a willful and deliberate failure to act to avoid those consequences. At this time, you are to decide only whether real water engaged in wrongful conduct warranting an award of punitive damages, and, if so, whether an award of punitive damages against real water is justified by the punishment and deterrent purposes of punitive damages under the circumstances of this case. If you decide an award of punitive damages is justified, you will later decide the amount of punitive damages to be awarded after you've heard additional evidence and instructions. Instruction number 26. Clear and convincing evidence is that measure or degree of proof which will produce in your mind a firm belief or conviction as to the allegations sought to be established. It is an intermediate degree of proof, being more than a mere preponderance, but not to the extent of such certainty as required to be proven, to prove an issue beyond a reasonable doubt. Proof by clear and convincing evidence is proof which persuades you that the truth of the contention is highly likely. Instruction number 27. When you retire to consider your verdict, you must select one of your number to act as foreperson, who will preside over your deliberations and will be your spokesperson here in court. During your deliberations, you will have all the exhibits which were admitted into evidence, these instructions, and a special verdict form which has been prepared for your convenience. In a civil action, 3/4 of the total number of jurors may find and return a verdict. This is a civil action. As soon as 6 or more of you have agreed upon each answer required by the directions in the special verdict form, you must have the verdict signed and dated by your foreperson, and then return with it to this room. Instruction number 28. If during your deliberations you should desire to be further informed on any point of law, or hear again portions of testimony, you must reduce your request to writing signed by the foreperson. The officer will then return you to court where the information sought will be given to you in the presence of the parties or their attorneys. Readbacks of testimony are time-consuming and are not encouraged unless you deem it a necessity. Should you require a readback, you must carefully describe the testimony to be read back so the court reporter can arrange her notes. Remember, the court is not at liberty to supplement the evidence. Instruction number 29. You will now listen to the argument of counsel, who will endeavor to aid you to reach a proper verdict by refreshing in your minds the evidence and by showing the application thereof to the law. But whatever counsel may say, you will bear in mind that it is your duty to be governed in your deliberations by the evidence as you understand it and remember it to be, and by the laws given to you in these instructions, and return a verdict which, according to your reason and candid judgment, is just and proper. All right, do the parties stipulate that jury instructions 1 through 29 have been read to the jury?
Yes, Your Honor. Yes, Your Honor.
All right, I'll go ahead and sign them. And how much time do you need to set up? You ready to go?
All right, Your Honor.
You ready? Okay, ladies and gentlemen, what we're going to do now, we're going to go right into closing arguments. All right, Mr. Kemp.
Good afternoon, everybody. Again, my name is Will Kemp, and first of all, I'd like to thank you. I think it's been a relatively interesting trial compared to some of them that happened in this building, but we appreciate the fact, that you've come down here for the last 2 weeks and given your attention, and we all know that you've been giving your attention because, we've observed you doing so. Okay, let's, before discussing the permanent injury that each one of the 15 plaintiffs in this case suffered, let's start with the toxin, hydrazine. Shane? So hydrazine was the toxin. Real water contained hydrazine. Hydrazine is a toxic rocket fuel. Hydrazine causes acute liver failure, and hydrazine caused liver injuries in the case. All of this is agreed to. There is no dispute about any of these points. Okay? You heard the defense witnesses this morning. They all agreed to it. All 4 of these facts are agreed to. But just in case, the first point, we have the FDA test. They went in and they tested the concentrate. Remember, they went to the plant in, I think it was March of 2021, grabbed 3 containers of concentrate, tested them, and they found these exceedingly high levels of hydrazine in each one of the 3. 1.44, 1.75, next one, Shane, and 1.33. And Dr. Cosnet talked to you about that quite a bit and said that that's enough hydrazine to cause acute liver failure. Again, that's not disputed in this case. Hydrazine, next, Shane, that is the same substance used as a rocket fuel. That's on the left, that's a NASA rocket going up to, that might actually be the moon rocket. Hydrazine was used to power that rocket. Next, Shane. Hydrazine is used every day, hydrazine derivative by SpaceX, Elon Musk group. And you see the gentleman on the right, they're very careful being around hydrazine because they know the problems that you can have if you contact it. Now, hydrazine is highly toxic, so we called a toxicologist. He was the very first witness, Dr. Cosnet. He, again, he's a scientist that studies what toxins do to your body. He talked about the literature a little bit. And let me just show you a couple things he said about some of the cases of hydrazine poisoning in the literature.
So let's talk about these briefly. This is one of the studies that you saw, and this was published in Finland, and actually it was a gentleman who worked with hydrazine 1 day a week. He handled it. They didn't specify exactly, but he probably had some inhalation exposure and thermal exposure. And he was a machinist. And after 6 months, he started to get ill. And that's what he had. He had a very high bilirubin. That's what causes you to become jaundiced. And he wound up actually dying. And they attributed his death to being exposed to hydrazine. And when they did an autopsy, they found evidence of liver damage.
So this is the reported scientific literature. Again, this isn't dispute. You get exposed to hydrazine, you could die. And we told you about another case where this guy tried to take hydrazine to cure cancer. Instead, he got encephalopathy, which pretty much all the plaintiffs got. The brain swelling. Go ahead.
Yes, he died of hepatic encephalopathy, which is a form of brain swelling and brain damage that you get. Remember that was talked about in some patients. This is a case of hepatic encephalopathy. So this is a guy who's taking hydrazine and he died and he had hepatic encephalopathy.
So hydrazine is so toxic that if you inhale it, you get it on your skin for a brief period of time, or you swallow it for a brief period of time, you can die. It is a highly toxic material. And I want to emphasize that hydrazine-laden water was poured on every one of the livers of plaintiffs. Rocket fuel was in the bottled water. That rocket fuel went directly onto their livers. And it's not something innocuous. You heard a little bit about Tylenol potentially causing liver damage. This was rocket fuel that went right on their liver. And it wasn't for a brief period of time. You know, we showed you the case where someone had it for a day and he died. It was for months and months for many of the plaintiffs, for some of them years and years. They are having rocket fuel poured on their liver. Now, fourth point. Hydrazine caused the liver injuries of all the plaintiffs. This is contested, okay? The judge told you things were stipulated, that means they're agreed to. Okay, this is a fact that is agreed to in the case, that the rocket fuel caused the liver injuries of the plaintiffs. You know, in some cases, you, the jury, have to find causation. You don't have to find it in this case. They have agreed that the toxin in this case caused the injuries. Okay, so the first point on the verdict form is going to be compensatory damages. And the first question is going to be, what are appropriate compensatory damages for someone that suffered acute liver failure? Again, let me pop up my liver slide. You've seen this 4 or 5 times. You know how important the liver is. Go to the next one, Shane. This is a case involving acute liver failure. The liver completely fails, and if it doesn't resolve itself quickly or you get a transplant, you are dead. It's a medical emergency. You have to go to the ICU. So it means that the liver completely stops working, and that's what this case is about. And again, it's rare. This doesn't happen much. Okay, 2,000 cases each year, and we have 15 plaintiffs sitting here. And 20% of the people with acute liver failure die. You know, luckily none of the plaintiffs have died. So all of the 15 plaintiffs had excessive AST and ALT. So again, AST and ALT are the 2 liver function tests, with INR is the 3rd one. Look at these readings, okay? 27 is normal for the AST. You see on the top where it says 15 to 27, and the ALT, it's 12 to 78. Trevor Abele, look at those numbers, 2,600. You know, all of them are very excessive. You know, I guess Brandy Brand wins because she's got the highest AST, 7,214. But all of these are unbelievably high numbers. And the reason, again, is because they drank the hydrazine and it caused acute liver failure. And I'd like to make a subtle point. Do you see Mr. Henry's AST and ALT, 1,122 and 647? Mr. Henry had to have a liver transplant. His liver was so shot, he had to have a liver transplant. But there are at least 8 different plaintiffs on this board that had worse liver function tests than the guy who had the liver transplant. Mr. Abele's are worse. Adair's are worse. Gray Maynard's are worse. Carlo Moreno's worse. Lorenzo Muniz is worse. Daniel Taylor is worse. Daisy and Brandy are both worse. So these people had more damage to their liver than a man that had to have a liver transplant. Now, Dr. Hudson explained that all the plaintiffs had acute liver failure. And again, this isn't disputed, but I want to play his testimony real quick on this point. Go ahead, Jay.
And with all of these plaintiffs, based upon your review of all their medical records from Dr. Hudson, that they all suffer, except, of course, we'll go back in terms of transfusion, but for everyone else, they all suffered acute liver injuries.
They did.
All caused by real water.
Correct.
Can you give that opinion to reasonable degree in the medical process?
Yes, I did.
Okay, everybody had acute liver failure. So now we get to what you have to do in the case. This is the verdict form. Shane, pop it up, please. So this is pretty simple. You have everyone's name. Go ahead, Shane, bottom. Everyone's name, and you have, first of all, their past damages for physical pain, mental pain, permanent injury, and loss of enjoyment of life and anguish. Okay? These are all separate categories, and I'm going to go through them in a minute, but you're just going to put one number. Okay? For each plaintiff, you're just going to put one number. And then the other part of the verdict form, Shane, this is for future damages. Are we on the other part?
We have that later on. Do you want me to jump to it?
No, skip. Let's skip it. Okay, so let's start with the past damages. You have a jury instruction on that. The judge just read it. It's jury instruction 21. This is what you're supposed to award damages for. Physical and mental pain, suffering, anguish, disability, disfigurement, permanent injury, and loss of enjoyment of life endured by each plaintiff from the date of his injury to the present. And that's supposed to be from the date of the injury to today. Okay, that's past damages, damages from the past. So, and all the plaintiffs, some of their injuries started a little earlier than others. You know, Mr. Abeley's back in 2016. Some of the plaintiffs are 2020s. So you got to take that into account, but this is just the past damages. Now, let's break that down a little bit. Shane, next one, please. So here are the 4 subparts. And again, I'm taking them out of the actual jury instruction. It's jury instruction 21. 1, physical pain, suffering, and anguish. 2, mental pain, suffering, and anguish. 3, permanent injury. And 4, loss of enjoyment of life. And let me give you some examples. First of all, the first one there is physical pain. Let's have a couple examples that you heard during the trial of physical pain. This is what physical pain is. Can I have first one, Shane?
He was in so much pain that he would just scream day and night. The itching from the liver, I guess it causes skin rashes, and that's what he got. So he had a rash that moved all over his body, and he would scratch especially his hands and feet from pain. So we would have to sit on him and hold him down and keep him from going till they were itched, till they were raw and bleeding. So we would literally have to sit on him and hold his hands down and screaming. If he got up to go to the bathroom, it was so painful that he was crying in pain, screaming out for either my husband or I, "Mommy, Daddy, help, help." And we would run to him, and his urine was the color of amber, like dark, dark amber. If he had a bowel movement, it was like white Play-Doh. It wasn't, he couldn't keep any food down. He was only having Pediasure shakes and water. We couldn't keep anything else down.
Remember, this was a 9-year-old boy. A 9-year-old boy, so much pain that he screamed night and day. And then there's other types of physical pain in the case. For example, the liver biopsies. We told you, and some of the plaintiffs described it, how they stick the needle into the liver. They can't give it an anesthetic. There is no anesthetic on the liver. You know, they're sticking it in there raw. Okay, and that is why it is so painful, because they're sticking the needle in, there's a little clasp on it, it chunks down on the sample that they're trying to take, and then they rip it out of you. That's exactly how the operation is done. And that is painful. Let me have Monica Branch-Noto tell you her story.
And they have to figure out where to stick the needle. This big. While I'm awake, with a little pincher at the end of it, so they numb you a little bit right there to where they put it in. They put the needle in, and they're looking on the screen. To see where they want to take a piece of the tissue. And they tell you it's going to be a little crampy. And I felt the moment that he went this piece off. It wasn't clampy, it hurt. And he did that, and I believe he had to pull that out, give that sample, and then they had to get another sample, so I had to go through the same thing again. And it's a long needle, and you're awake, and they just stick it in your skin and right into your liver, and pinch a piece of it off, or cut a piece of it off. It's painful.
So that's an example of specific pain. And remember, 6 plaintiffs, 7 if you count Mr. Henry, had liver biopsies in this case. Okay, so 6 plaintiffs went through exactly what was described here. That is specific pain, specific pain. In addition to that, you have the general pain of being poisoned by a rocket fuel over and over again for months and years. And all the plaintiffs in this case suffered from repeated poisoning. And this slide kind of shows the continuous torture that was inflicted upon these plaintiffs. They drink the poison, the real water with the hydrogen in it. They get sick, and there's a lot of similarity. In fact, it's virtually identical in all the symptoms: nausea, vomit, fall down, confused. Again, that's the encephalopathy. They get dehydrated, and then what do? They drink more real water. They drink more rocket fuel. Okay? Then they go to the hospital. They're poked and prodded. No answers from the doctors. You know, the doctors don't know that this is some sort of bottled water that's made by this electrolysis process where they're using a battery cable and they're electrifying water for 8 hours, 2 times, 2 different 8-hour stints. Doctors don't know that. So no answers from the doctors. And in a lot of cases, the 2020 cases, they're alone in these hospitals. Alone in these hospitals because they won't let anyone else in. So think about that for a minute. You're confused, you have the encephalopathy, the doctors can't give you any answers, and a lot of them are told that they're going to die unless they get a liver transplant. And in at least 5 of the cases, they brought in the plaintiff's family and they went and got the will and various things. So they go to the hospital, they drink the good hospital water, and then they get better. Okay, they slowly get better, the liver function tests go down, they cancel the transplants, and then they're sent home with unknown etiology. The doctors don't know what caused it. Then they drink real water again, and they get sick again. So this is the cycle that people went through, and this is the general pain, okay? And for some of the plaintiffs in this case, this was just weeks or months. But others, it was years. It was years going through this. And the devil himself could not have devised a greater torture method than this. Think about it for a minute. The toxin is making you throw up, you get dehydrated, you drink more of the toxin, they can't tell you what's wrong with you. A lot of cases, they blame the plaintiff. Okay, you heard Monica Branchinoto where they were saying she was an alcoholic. I mean, they blame the plaintiff, and I don't blame the doctors. They're looking for answers, they can't find any. Because who would suspect that bottled water would have rocket fuel in it? But anyway, the devil couldn't come up with a better torture system than this. Couldn't do it. And let's just listen to Monica Branchinoto describe this in and out of the hospital, sick and better, you know, cycles.
So I believe I've been home from the hospital about 3 days. And I just go right back to drinking water, you know. It's real water, it's healthy water, of course. You know, they always say drink a lot of water. Water's very good for you. So I did, and about the 3rd day home, I got violently ill. Just throwing up and throwing up and throwing up. I think I threw up for 24 to 36 hours straight. And I think because, again, like I've mentioned before, when you throw up, you get dehydrated, so you drink more water. So I'm throwing up, drinking more water, throwing up. So that was probably one of the worst times.
Okay, and again, this is the general pain. My next one, Shane. And I just want to emphasize this point. It's a hidden poison, okay? This is a hidden poison. It's not like when you go into the hospital and you got bit by a scorpion or something like that, and the doctors know what it is and they can prepare the anti-venom. It's a hidden poison, and it's in an essential and innocuous substance that you have to drink every day, water. The doctors can't find it. The poison makes you dehydrated because you're vomiting, your body's trying to get rid of the poison, so you're dehydrated, and what do? You drink more poison, more water. Next, Shane. And you're mentally confused. These people don't know what's going on. You know, they're near coma or in coma in some cases. They don't know why they're in the hospital, much less able to figure out what's going on here. And then they get better when they drink the good hospital water. They go home, they drink more real water, boom, right back in the hospital, okay? So you have repeated poisoning for months and months and years, and again, that is the general pain and suffering that everybody suffers. And just a couple examples specifically, Daisy Wee. So from June 2020 to November 2020, she's going to hospital after hospital after hospital after hospital. Loma Linda's, where they sent her for the liver transplant on the emergency flight. No answers. Gets out of the hospital, drinks the hospital water, getting a little better, and boom, right back to drinking the poison, and she's back. And look at these emergency room. You know, Daisy must have known every emergency room attendant in town after this experience, but emergency room, emergency room, emergency room, emergency room. And it's all for the same thing, and they're all prescribing the same thing, acute liver failure. And again, like I said, this is agreed to. All right. And this is Carla Moreno and Adair Atak. So Carla and Adair, remember they were boyfriend and girlfriend? So Carla told us about this. But look at this. I mean, half is one and half is the other. But I haven't counted, but there's probably 12 on each side, so 6 on one, 6 on another. And Carla told you pretty much what's going on. They get better, they go home. They get sick, they go back to the hospital. They get better, they go home. They get sick, they go back to the hospital. And in this particular case, it's going on for about 2 months, right? Okay. And Trevor Abley, you know, he's a special case because he's 9 years old at the time. Remember, he went to the hospital. His spleen was so big that they knew he couldn't fight off infection, so they had to get him out of that hospital right away. And they wanted to send him to the, I think it was UCLA, to do the liver transplant. Couldn't do it. Couldn't put him on an airplane because of the enlarged spleen. So he goes home. He goes home, and for 90 days, he's got bed rest. Shane?
He did. So we, on Friday, met with the pediatric GI doctor, and I remember this very vividly. And he said, I'm going to send you next week on Monday. I think we're going to finally send you out to UCLA. He's not getting better. And you're going to start the review for a liver transplant. And my husband wanted to give him his liver. There's no way to do that, but he was ready to. He said, you know what? I'm going to send you on Monday, but I'm going to wait one more day. I'm going to test him one more time on Monday, and I'll send you on Tuesday out there. So get everything, you know, in order, wrap up your affairs, what you need to do before we send you. And we just prayed and prayed so hard, had Trevor on every prayer list that we could put him on. And I did a great reset. I went through my entire house. We had no idea what was causing it. I threw out pots and pans, cleaning products. I threw out food, cleaned out my pantry, my fridge, everything. We had no idea what it was. And I changed his water. And I bought water that was in a glass bottle. And over the weekend, his numbers started coming down. He was retested on Monday. And we kind of regrouped and had a new plan.
He was going to get a liver transplant on Monday. And then somehow or another, Mrs. Abley, you know, maybe it was, you know, the hand of Providence touching her. She did what she calls the Great Reset. She threw out everything. All of a sudden, he's not drinking real water. And after 90 days of being tortured, repeated poisoning, after 90 days of that, he starts getting better. So those are examples of general pain and suffering. So let's turn to mental pain and suffering. That's the second one. Okay, physical pain we've talked about, specific pain, general pain. Now we're talking about mental pain, suffering, and anguish. Okay, let me have Lorenzo's slide, please. This is an example of mental pain.
And what was that experience like?
I heard earlier, I would not wish that on my worst enemy. I completely agree with that. And also that It is unfathomably traumatizing. There's just no way to explain that type of horror of the uncertainty and the thrashing around in your head and the scared family staring at you. It was traumatizing for sure.
So mental pain and suffering, you're in the hospital, they don't know what's wrong with you. They bring in your family to say their last goodbyes. That is extreme pain, suffering, and anguish. Because these people, look at him. He thought he was going to die. All right, and let me give you another example of mental pain and suffering. Go ahead.
And the doctor does blood work, and you hear the next morning, get to the ER, you're in liver failure.
Yes.
What is going through your mind at that point?
I think I'm gonna die. I don't know. That's the first thing I went to. I've never heard of liver failure, but I can't live without your liver, and if it's in failure, I could die and lose my... I'll be here for my kids. Grandkids.
I think I'm going to die. What greater fear and anguish could you have than that? Let's have Mr. Taylor's, please.
And the doctors, they were basically asking me if I had a will. And I said, yeah, actually I do have a will. And they instructed my wife Josephine to go home and get it, which was obvious purposes. Obviously, that was serious, and that scared the heck out of me. It was either the same day or the next, right around there. Everything was very fuzzy around that time. My mother-in-law, my ex-wife's mother, she brought my children in, who were 9, I believe 9 and 13 at the time, to see me, and I could just distinctly kind of, see their reaction and tears, off to the side, and her kind of stunned look, and it was clear to me that, they were kind of almost coming to say goodbye to me, possibly, that was the pretense that they were brought to the hospital for, is to most likely see me before I pass, or that it was a high probability that I was going to. So it became clear at that point.
And I'm going to get into it in a minute, but remember Mr. Taylor had the 8.8 INR. They thought he was going to die, okay? But back to the anguish, suffering, these people, number one, they thought they were going to die. But number two, they're in there with their loved ones, and the loved ones think they're going to die. And, I could go on and on with all the plaintiffs. Remember Daisy, they made her bring her power of attorney in. Other people, similar stories. Okay, let's go to the next one, loss of enjoyment of life. Oh, wait, one more sheet. So loss of enjoyment of life, that's just, you can't do what you ordinarily do. I mean, you're fighting this injury. These people were put out of commission for months, if not years, so loss of enjoyment of life is the last damage. All right, permanent injury. This is the only damages component that is contested, okay? A little bit. Not contested much, but it's contested a little bit. So, you had Dr. Robbins this morning, the liver regenerates itself, but I can't say that any of these plaintiffs are going to get better. But permanent injury is contested a little bit. All the other ones aren't contested, okay? All the other ones, it's just a matter of picking a number. Permanent injury, I think you need a little more analysis. Okay, so let's start with Dr. Hudson on the permanent injury.
Do you believe that each one of these plaintiffs, those that actually read biopsies, suffered permanent injuries because of their consumption of the water?
Yes, sir, I believe that they have.
And you believe, or we know that DuPont Henry actually had to go through a liver transplant.
Yes, sir.
But based upon your review of the biopsy slides, your review of Dr. Datnow's reports, and your familiarity with hydrazine as a liver toxin, do you believe that all of these plaintiffs have now suffered permanent liver injuries?
Yes, sir. And to qualify what we mean by permanent liver injury, scarring. Scarring of the liver. Inflammation goes away. You know, those things go away. Those all pretty much resolve. But scarring is a more permanent injury.
Okay, remember both of the defense witnesses this morning conceded permanent injury. We had Dr. Robbins who said, well, yeah, they're permanently injured and they're more susceptible to future liver injury than other people. He tried to quibble a little bit about the ratings, and the ratings being the 1, 2, 3, 4, but he did concede ultimately that they had permanent injury. And then Dr. Alsina, not only did he say that they have permanent injury, but he says, well, we shouldn't scare them and tell them that they might have to get a liver transplant. That's what he said. We shouldn't scare them and tell them that. And then he said that to avoid progression, the liver getting worse and worse because of the pre-existing injury caused by the hydrazine, to avoid that, everyone's got to be on strict diets. They got to follow doctor's instructions to the letter. God help them if they take 2 Tylenol one night, you know, because that can damage the liver. So these people have permanent injury. Let's have one more from Dr. Hudson, just to cement this issue.
And that type of scarring can affect liver function.
Yes, sir. Particularly this type of scarring, where Dr. Mackler put on there bridging fibrosis, that is, when we have bridging fibrosis, we basically sort of grade the liver in terms of scarring. 0, 1, 2, 3, and 4. 0 is normal, okay?
Now, we have pictures, tissue slides from 6 of the plaintiffs, well, 7 if you count Taquante. And we also have a tissue slide from the Morales baby. And again, that's one of the 5 babies that flew up to Salt Lake. So this is the Morales baby, 22 months old. When this biopsy was taken, this baby is 22 months old. I mean, here, well, let's have Dr. Dano explain why this is cirrhosis shape.
Okay, so a complete circle is called a cirrhotic nodule.
Correct.
Or cirrhosis.
Cirrhosis.
And is that permanent?
That is permanent.
Permanent liver injury, okay? So he looked at Daisy's slide and he found the same thing. Next, Shane.
Okay, what do you see on the October 3rd, 2020 slide?
Here you can see the fibrosis is extremely extensive. Full area, full area, full area, full area, full area. You can see the excess fibrosis in the full area, and the bridging is absolutely extensive. And this is another one where I'm not seeing 100% surrounding the nodule, but I highly suspect.
Okay, remember what Dr. Robbins said? He didn't want to talk about this slide. He went to the one a month later and he told you it wasn't prepared correctly. Remember he told you that? He said, they didn't slice it right. They put the stain on wrong. But looking at this slide, she looks better, you know? I mean, if the slide's not prepared right and the stain is put on wrong, how can you get any information from that slide? And yet he still conceded that she had permanent injury. Okay, next, James.
Suspicious that this is a full, but it's at least a
Okay. And you say highly suspicious, it's more likely than not?
correct.
But not 100%.
Not 100%.
Okay, and remember our burden of proof here, we have to show it's more likely than not they have permanent injury. We don't have to show beyond a reasonable doubt or 100%. We have to show more likely than not. That's what Mr. Parker explained early on. And so this is exactly what he's saying. More likely than not that this is cirrhosis. Cirrhosis, everyone agrees, is permanent injury.
We have one more from Dr. Hudson.
Okay, let's see it.
And so we will agree with medical probability. Is your opinion that all of these patients, all these plaintiffs suffered permanent injuries to their liver?
I do.
Okay. And, you know, there's been some discussion about, okay, the ALT scores, the AST scores went back to normal. They're normal now. Well, that doesn't mean they don't have permanent injury. Okay? Go ahead, Shane.
So just because they look fine, doesn't mean that they're not having culture to live.
That is correct. But over the years, I've seen patients walk into my office that came in because they had a little fatigue and or maybe another reason, and normal looking, no yellow, they feel normal, they look normal, and you do liver tests normal, but something doesn't mount up, and you work that patient up, turns out it's wrong. So you can be walking around with cirrhosis and not know it.
And this isn't in controversy either, the proposition that if you have normal ALT and AST, you can still have permanent injury. And the reason I say it's not in controversy is Dr. Lynn was the defense hepatologist who testified Friday. This is what he said. Oh, and so you can actually have AST and ALT normal readings and still have liver injuries, correct. So him and Dr. Hudson, same page. Just because the liver function tests go back down doesn't mean you don't have permanent injury. Now, here are the 4 damages in this case. Okay, what I'm going to suggest to you is that you have to come up with some sort of baseline for compensation for an acute liver failure case. And I'm going to give you the only baseline that's in the evidence, but I think you need some kind of baseline, okay? And you can apply it to each one of the plaintiffs and decide whether they should be more than that or less than that, depending on their circumstances. You know, for example, Pam Brown's almost 80, okay? She wouldn't have the same potential injuries in the future that Trevor has because he was 9 when he was hurt, okay? But I think you need a baseline for what the physical pain and suffering, the mental pain, the permanent injury, and the loss of enjoyment of life would be for an acute liver failure case. Now, it sounds like a difficult task to come up with a baseline, but remember, all these people had pretty much the same symptomology. They all had acute liver failure, nausea, vomiting, fatigue, confusion, stumbling, falling down. Remember Mr. Watkins fell down the stairs before he went to the hospital, after he went to the hospital, high liver function tests, in and out of the hospital, in and out of the hospital, and then they have permanent liver scarring. So I think what you got to do is come up with a baseline. And you remember, none of the plaintiffs in this case testified to a figure. Okay? None of the 15 plaintiffs said, this is the figure. So I'm sure you're thinking, do we have any evidence, okay, not arguments by me, not arguments by Mr. O'Du, do we have any sworn testimony from any witness as to what a baseline should be? Yes, we do. Okay, next, Shane. Here's Blaine Jones. Remember he went on that little trip to Utah, got acute liver failure on October 5th. He was the one that made the concentrate in the concentrate room. Okay. Next, Shane. This is his, I don't want to play it again just because it'll take a long time, but he went to ICU, kind of like everybody else, checked him in intensive care. His dad came up and got him, drove him back to Vegas. Go ahead, Shane. You know, they had specialists come in and said maybe you need a liver transplant. So he went through pretty much the same thing that a lot of the plaintiffs went through. And he gave us a number. This is his sworn testimony. Go ahead, Shane.
Okay, and it says, on the next sentence it says that debilitation of liver failure, I have been to hell and back. Did I read that right?
Yeah, it was a very terrible experience.
Okay. You want to go through this again if I gave you $10 million, would you?
Yeah.
So there's the baseline. That is evidence in the case. That's not argument from an attorney. That is the sworn testimony from the vice president of Real Water that had the exact same acute liver failure as everybody else, that he thinks the baseline ought to be $10 million. Okay, that's not binding on you. You can go lower, you can go higher, but I think you need some sort of baseline, and then you can start applying it on a case-by-case basis. Okay, but this is the evidence, okay? This is sworn testimony from Blaine Jones. You know, Mr. O'Doon doesn't like this, and he's gonna get up and argue about you, why you should ignore this, but this is evidence. This is testimony in the case. Okay, let's go through each plaintiff one at a time. Let's highlight their injuries, and let's kind of compare them with Blaine Jones. Okay, this is Mr. Abley. Okay, again, he's hospitalized in 2016. The enlarged spleen, he had to go home for bed rest, 9 years old, 3 months, scheduled for liver transplant, so much pain, he screams every day and night. And they had to hold him down to keep him from scratching himself to the point he'd be bleeding. The family had to hold him down. So after 3 months of elevated LFTs, Mrs. Abley, you know, thank God she did this great cleanse. And all of a sudden he gets better, and he doesn't have to do a liver transplant. But he didn't find out for 5 full years what the poison was that laid him to waste, okay? Remember, he's March 2016. It wasn't until March 2021 that he found out. So he had to live through the fear of what caused my injury for 5 full years. Next, Shane. There he is. That's Trevor on the left. That's his brother on the right. You know, obviously a very close family. So 3 months sitting on the couch. 3 months when you're 9 years old, sitting on the couch, immobile. And I don't want to go through what Mrs. Abley told you the other problems were, but think about that for a minute. Okay, and I just want to reinforce this. Okay, this is the only reason they didn't send him to get a liver transplant. The only reason. Go ahead, Jane.
So we were sent home, and he was put on bed rest for over 3 months, but he could not move. He couldn't do anything. He couldn't go to school. He couldn't play sports. He couldn't be around anybody. I put my entire life to the side and did not leave my child. He violently threw up, constantly nonstop for weeks. We had to go multiple times a week, every few days, to do blood work. And because his spleen was so enlarged, I ran the risk every time he threw up that his spleen could burst and he could bleed out in minutes. So they told me it was more dangerous at the hospital than it was at home. But I was so scared every time he threw up that I was in a complete panic. I had to hold it in because I was scared his spleen was going to burst and rupture and he was going to bleed out in minutes and I wouldn't have time to go to the hospital. I cannot tell you how scary as a parent this is, that you're helpless. There's nothing that you can do for your child. We don't even know what's wrong. We have no idea how to help him. My husband and I were just at a loss. He slept on the floor in his room at night, so he was never left alone. I didn't leave his side all day.
Now think about that. 3 months, this enlarged spleen is a time bomb that they're afraid at any time can kill the child. A time bomb for 3 months that they're afraid can kill the child. So let's compare Trevor's injuries with Blaine Jones, okay? Go ahead.
There's some more video testimony.
Oh, I'm sorry. Let's hear what Trevor says about his injuries.
So I remember I would wake up with rashes all over my body and they would itch and I would itch myself till I bled. And my parents and my brother would have to hold me down because I couldn't help it. And I was in an intense amount of pain, and I was constantly throwing up throughout the day, and I would have to carry a throw pole with me everywhere I went. And I couldn't even, when I would have to go outside to go get blood tests, I had to get blood tests every 2 days. And I couldn't even drive in the car because I would get motion sick, and my mom would have to stop multiple times just on like a 10-minute drive for me to throw up on the side of the road. And it was, I just felt weak every single day I woke up. I felt lethargic. I just didn't feel like doing anything. I had no motivation to do anything. And I also I had to use the restroom probably about every 5 to 10 minutes. And I really couldn't do anything. So.
Okay, let's go back to Blaine Jones's testimony. He's got the $10 million figure. Now I'm going to compare Blaine's situation with Trevor's. So Trevor had the ASTs off the charts, 2,066, ALT 2,600, swollen spleen, Blaine didn't, forced bed rest for 3 months, Blaine's in the hospital for 3 days. Trevor had a liver transplant scheduled, Blaine didn't. He kept drinking the poison for 3 months until the last minute great reset by the mother, and he's got permanent injury. Whether Blaine Jones has permanent injury, we don't know. So I would submit to you that whatever the baseline figure is, okay, Trevor should be above the baseline figure. All right, next one, Shane. This is Monica Branchinoto. And remember, I've already played 2 clips from her. The first clip discusses the repeated poisoning that she suffered. And the second clip was what she was fearing at the hospital, I think I'm gonna die. So this is a third clip.
Before we get there, I want to ask you, at any point when you were hospitalized between December 3rd and December 7th, 2020, were you able to have any visitors?
No visitors. I couldn't have any visitors. My family couldn't come. My son couldn't come. They could bring me food, but they had to leave it at the front door of the hospital. And that's very hard because I don't know what's going on. I'm confused, I'm fatigued. I have 3 different doctors coming in and telling me all different things, and I don't know who to talk to. I don't have someone there on my side or my family to discuss this with. And even I have my cell phone. I could call them, but I don't even remember what the doctor said. So I basically had to sit by myself.
So let's do the bullet points quick, Shane. She's in now the emergency room from November to early December, then she's hospitalized at St. Rose for 4 or 5 days. She's got the INR of 3.35, normal's 1. She had liver biopsy. She told you about it, how they had to go there and rip her pieces of her liver out. Thought she was gonna die. And she didn't find out that real water was the poison that was causing this injury for 4 months. 4 months until March 2021. Okay, so let's go. So here's the baseline figure from Blaine. Next, let's compare Monica to Blaine. She's sick for 2 months, he's sick for 2 days. She's got encephalopathy. We don't know what his mental state was, although it sounded like he was bad off. She had liver biopsy, Blaine didn't. They both were counseled by the liver transplant. They were hospitalized about the same number of days. She kept drinking after her discharge and she had more problems. And she has cirrhosis now. Cirrhosis, a permanent liver injury. And Blaine doesn't, okay? So I would submit that Monica should be higher than whatever baseline you choose. Hunter Brown. So Hunter went to the hospital, but they didn't have a bed for him, okay? He needed to be hospitalized, but they didn't have a bed because of COVID. Go ahead, Shane.
So this was December 2nd, 2020, basically the height of COVID infections. They didn't have a bed for me. That's how many COVID patients they had there. They put me in the, basically in the, kind of the waiting area. They did give me an IV, which I was happy, in retrospect, the IV that they gave me was the fluids they gave me were flushing out the real water at that point, and that I'm sure helped me.
And you were discharged later that day?
Yes, I was there from around, I was there maybe 6-8 hours, something like that. And because they didn't have a bed for me, I didn't have a choice. I basically had to go home.
So who knows how long they would have kept him in there if they'd had hospital stays, 4 days, 5 days. Who knows? Nobody knows. But the point is, he was so sick that they were going to hospitalize him. And then Hunter told you about the rough time he had when he went home and he is drinking the poison again. Go ahead, Shane.
So I got down to 120 pounds, which I haven't been since maybe junior high. Instead of sleeping all day long, I had insomnia. Maybe in a week, I slept about a half an hour total in a week. I can't tell you how that was maybe the toughest thing out of anything. My digestive system didn't work at all. I went from having really bad diarrhea earlier to having partial bowel blockage, to where I didn't go to the bathroom for 5 or 6 days. And when I finally did, it was the most painful experience of my whole life. I had to wear an adult diaper for several days and get rubber sheets on my bed, like I was like a baby or an infant or an 80-year-old or something. It was just like a nightmare that seemed like it was never going to end.
A 40-year-old man forced to wear diapers and put rubber sheets on his bed. And like I said before, he gets out of the hospital and drinks more real water and the poison again and again, repeated poisoning. So let's have the next slide, Shane. So he went to the hospital, couldn't get in, sick for months. He was diagnosed with encephalopathy. Okay, again, that's the brain fog. He lost 50 pounds. And so Dr. Hudson says Andre has permanent liver injury, but doesn't have cirrhosis, thank God. But permanent liver injury. And again, it took him 4 months to find out what was causing his problems. So what is the baseline for Hunter compared? Excuse me, ladies and gentlemen. So Blaine was hospitalized for days. Hunter went home right away. Blaine was counseled about liver transplant. Neither Hunter or Blaine had one, but Blaine was counseled about it. Extensive physical deterioration after the hospital visit. Blaine got better relatively quickly, and Hunter kept drinking real water. I think this is probably about the same. Okay, I'm not going to push this one. This is probably about the same as Blaine Jones. Okay, next one, Pam Brown. This is Hunter's mother. She was at the hospital 3 days before the Hunter did on November 12th, and this is what Pam told you about her condition.
And what were some of the symptoms that you were starting to develop?
I felt like I was walking in concrete. I couldn't feel my legs. I was having like triple vision. It was primarily neurological symptoms.
Okay. Let's have a slide. So she's hospitalized, she's sick for weeks. She had elevated ALTs, but nothing like some of the thousands we've seen. She was at higher risk because of her age. She has permanent liver injury, but again, no cirrhosis. It took her 4 months before she found out what the poison was. And I think when you compare her to Blaine, you have to say that she should be less than whatever the baseline is, okay? He's hospitalized for days, she went to the ER. He's told he might have to have a liver transplant, wasn't counseled about it. I think you'd have to say that she would be lower. Adar Etop, okay? So Adair was hospitalized twice and he had a liver biopsy. And this is what his then girlfriend, Carla Moreno, told you about his condition. Go ahead, Jim.
I understand. And during that time while you're waiting for the primary care provider, what was Adair's condition?
He was getting worse as the time was going by. He was getting delusional and was losing all ability to walk. When he first came out of the emergency room, he was still kind of able to stand, and I was able to, help him walk along. But as the time went by at home, he couldn't even walk to the bathroom or, do anything on his own. He couldn't feed himself at that time. He was barely able to have conversations or say anything. He was mostly sleeping and in and out of it, and it was just very worrisome. You know, you have no idea what's wrong, and he was still throwing up a lot at the time, and just really sick.
A deer had the highest ammonia level. Remember when the liver quits working, it doesn't process the ammonia, so the ammonia goes up and gets in the brain. So he had the highest of any plaintiff. He had 140. Very, very confused. And Carla told us how he was so confused, he tried to rip out the IVs, and they had to, I don't know what the right word is, they had to put the gloves around him, restrain him. Go ahead, Shane.
I was really afraid for Adair, leaving him alone, because he just had some kind of mistrust with doctors since forever. I don't know exactly why. And being in the hospital by himself, I knew that once he'd wake up and kind of be conscious of it, it would freak him out. And unfortunately, the next morning when I came, he was in very bad shape. He had woken up, I guess, in the middle of the night somehow and tried to rip off his IVs, and they ended up having to glove his hands so that he wouldn't hurt himself.
Shane, we have a picture of that, right? There we go. So confused, he's trying to rip out the RVs. He wants to escape the hospital. I mean, that's natural. So they have to restrain him like this. All right, he had a liver biopsy, and Dr. Datnow told you that the results were bridging fibrosis. Bridging fibrosis would be 3 on the scale of 1 to 4. Go ahead, Shane.
And how would you rate this one?
At least a 2. I have to look at more of the slide, but it's possible that we've definitely seen bridging. If not, sorry, it's at least a 2 to 3. We're not seeing wisp coming out, which would be 2. Remember, 1 around the fourth there is 2 of wisp coming out. 3 is bridging. This one is bridging. This would be a 3.
And that's your opinion, your original read, pathological probability.
Yes, it is.
Okay, and in addition to the permanent injury, the bridging fibrosis, he also had very elevated INR. Again, INR means international normalized ratio. That is the comparison of how quickly your blood clots compared to an international ratio. So he had 8.0, which is not the record here. 1 or 2 of the other claims were higher than that, but his was extremely high. Okay, next, Shane. So he's hospitalized 2 times, the 4th through the 9th, 13th through the 16th. Very high ALTs, ASTs, the INR I already talked about, acute liver failure, altered mental status, encephalopathy, and the permanent injury. And he didn't find out it was the poison that failed him for 4 months. Okay, here's the baseline again. Next one, Shane. So let's do the comparison. So they're both hospitalized twice. Adair was in their mower. Adair had the high ammonia and extreme encephalopathy. We don't know about Blaine. Adair had a liver biopsy. Blaine didn't. Adair and Blaine were both counseled about a transplant. And Dr. Datnow says Adair's got bridging fibrosis, a permanent injury. Blaine doesn't, as far as we know. Okay, so when you compare the 2 of them, I would say that Adair is much, much higher than that baseline figure. Okay, next plaintiff, Vincent Link. Okay, so Vincent Link was hospitalized twice. The first time was in July of 2020 for 4 or 5 days, and this is how he described it.
And do you remember when you first were hospitalized?
Yes, it was July 7th, I believe, 6th or 7th. I went to the Aliente ER, which is like a quick care extension of Mountain View by my house, and I was taken there by my housemate because I didn't really know what was going on. I was not able to drive or anything. And so the hospitalization, to answer the question, was that day they rushed me via ambulance to Mountain View Hospital from the ER extension.
And how long were you in the hospital?
That time, I believe it was 4, maybe 5 days at the most.
Okay, so the first time he's in Mountain View, goes back home, starts drinking real water again, same issues that everyone else has with repeated poisoning. Gets sick again, and he described to you how he was pretty much out of it in the whole month of October. And then finally he had to go back to the hospital, this time at Centennial Hills, from November 20th to November 23rd. And he told you about all the problems before, and basically he was in bed. He was in bed for weeks before the hospital. Go ahead.
I don't remember the date of admission, but I just know that I got sick right before Halloween, again, in bed, same issues, but severe, and confusion, and I apparently, at a moment I walked, I got out of bed for the first time maybe in a couple of days or so, and ran into my housemate who said that I didn't look good at all, and called my family and said that there was something wrong with my eyes, and I just was not there, and there was something wrong with my color. So they asked him to get me to the hospital, which at that point I elected for a couple of reasons to go to Centennial Hospital.
Okay, let's see the liver function test, Shane. Okay, AST, ALT, high, not as high as everybody else, but high. Next Shane. INR 1.9, higher than the 1, not an 8 or a 10, but high, okay? And then this is what I showed you during the opening statement, trying to explain what an INR was. So he's not getting enough clotting factor. Again, that's made by the liver when it operates efficiently. That's why he had to go in the hospital. All right, so he did not have a biopsy, but Dr. Hudson said that he had permanent injury. Okay, again, here's Dr. Hudson's testimony about Mr. Link.
And so we will agree that the problem is your opinion that all of these patients, all these plaintiffs suffered permanent injuries to their liver.
And Dr. Elsina and the defense doctors really didn't dispute that, that they were permanent injuries here. So next one. So these are the time he's in the hospital, sick for months, elevated ALTs. I think I missed the first hospital, which was in July. Same problems. And he also didn't find out that real water was poisoned for 4 months. So let's compare him to Blaine Jones. So he's in the hospital twice, Blaine's once. Blaine was told he had a liver transplant. Neither one had it. So Vincent suffered 5 full months, okay? Blaine got better after a short period of time. And Vincent kept drinking real water after the first discharge and had more problems. So I think maybe he's a little more than whatever the baseline is. Not significantly more, but a little more. Okay, Carla Moreno. And again, here's the timeline that we prepared for boyfriend, girlfriend, when they're taking turns going in and out of the hospital. So Deer's on the bottom. Well, I don't think Deer's on the bottom. So Carla is top left, middle, top. So she's in and out of the hospital, it looks like about 5 or 6 times. And she told you how sick and how scared she was. Next thing.
While you were in the hospital, did they tell you that you were suffering acute liver failure?
Yes.
What is going through your head at this point?
Well, I feel really sick, and I already saw my boyfriend in the hospital, so I'm thinking, what's going on? Nobody knows what's going on with us. This is really scary. You feel like you can literally die. And I saw him so close to getting transferred and getting a transplant and all that. And you never think it's the water you're drinking, obviously. You're thinking, what could I have done to get myself so sick? What could we have done since it was both of us? It must have been something that we came into contact with if it's both of us. So you're just scared.
And that's the fear prior to today. That's a past damages. Okay. So let's have the next slide. Well, she had a liver biopsy. So this is what she said about the experience.
While you were in the hospital, did you have a liver biopsy done?
I did. I had a liver biopsy on the day that they were supposed to let me go, discharge me. But my liver biopsy was horrible in my experience. Mine hurt a lot. The moment that I felt like the needle go in, it just felt like an elephant stepped on my ribs. And after that, it was really hard. The pain was unbearable. You could barely breathe. Like, you have to take very shallow breaths or else it hurts to talk. It was just, I would just cry by talking a little bit. You can't even move really. So it took me a while to leave the hospital because they had to give me more medication in order to sustain the pain. Couldn't get up from the bed.
An elephant stomping on her rib cage. That's what she said. An elephant stomping on her rib cage. Okay, and again, Dr. Datnow went over the tissue slide with you and said that she has bridging fibrosis. That's 3 on the 1 to 4 scale. Go ahead, Machine.
With a family hair, folded area, folded area, folded area, folded area here. The fibrosis around the folded area is massive. The bottom of the proliferation is massive. And you can see these strands of scar tissue or fibrosis are not just wisps going out. These are broad bands, and they are definitely bridging. And that bridging fibrosis is at least a 3 in the scale of 3 to 4. So this is quite severe disease. 3 out of 4.
So you rate this a 3?
3.
To reason degree of pathological problem.
Correct.
Okay, permanent liver injury at 3. This is a summary of what I just said. She went to the Spring Valley Hospital during that time period. Remember, she was in and out of the ER a lot of times before that. She had pretty high AST there, 2,273, again, 78 or 27 is normal, so she's 84 times normal. The elephant, bridging fibrosis, and she had to wait 4 months before getting some answers. So here's the baseline story from Blaine. So Carla's in there 8 days, Blaine's in there less days. Carla had the liver biopsy, Blaine didn't. They were both consulted about liver transplant, but neither had one. And Carla has bridging fibrosis. We don't know what Blaine's got. So I think maybe more than whatever the baseline's going to be. All right. This is one of my favorite plaintiffs, Mr. Maynard. Okay. Mr. Maynard, again, is the former wrestling champ and famous UFC fighter. And he had 2 bouts with real water. First, in 2018, he had to go to the hospital. Then he moved to Michigan. Then he came back here in 2021, and he was cleaning out the garage for his mother, and they found some real water. He started drinking again, and he got sick again. So you heard from Greg. He went from being one of the best trained athletes in the world to the ICU because he drank real water. Go ahead, Shane. Here's his medical entry. This is the date he first went in the hospital. Remember, it's the 2018 time period. Same symptoms as everyone else, muscle weakness. And he's been dizzy for 21 days. You know, these UFC fighters are tough guys. They don't want to go to the hospital. He's sick for 21 days and finally goes into the hospital. Next, this is another medical entry from Mountain View. See the AST, 1579, again normal, 78. ALT, 553. So, change of mental status, the same condition, the encephalopathy caused by the ammonia going up into the brain. Next, Shane. This is what Greg told you about. Again, this guy is one of the most highly trained athletes in the world. Here's what he told you.
Well, issue with this one, Mr. King.
Okay, I think we're at 164, 15 through 18, right?
Whatever, and my wife was too, so we were talking about it, and we just felt really like off balance, stomach was bad, you know, and each and every day, like it got worse and worse to where couldn't really see stuff, couldn't hold on to stuff. We had a brand new baby, we dropped him, thank God it was kind of right on the bed.
A UFC fighter who can't hold up a baby. Can't hold up a baby. Okay? And it got worse. Okay? He's going to tell you now how he was trying to go to the airport. He was dropped off at the airport by his father. This is what happened.
And so he took me to the airport, dropped me off, you know, and like I remember just all that stuff was kind of happening again. The crazy eyes and the twitching, couldn't hold on to stuff. Once I got through the gates, you know, I was like, all right, a ginger ale. Let me get a ginger ale and try to get to my gate. And this is when I was flying like all over the world, country, you know, different, probably twice a month, flying a lot. And then got a ginger ale, and I just couldn't like hold on to it. I kept dropping it. So I tried to go to my gate, but I guess I got the gate wrong with my seat number. So went to the wrong gate. Yeah, went to the wrong gate, confused, told me to go to another gate, got there, and you know, the flight left.
UFC fighter can't even board an airplane. So confused. And we showed you that he lost his next big UFC fight. He told you about the problems during training. And he's not beaten. He really wasn't beaten by another UFC fighter. He was beaten by real water. Beaten by the hydrogen in real water. So let's take a look at Blade's baseline.
I don't really remember those 2 days. I was just sleeping on the couch, waking up to, like, I'm pretty sure my dad checked on me, and then sleeping again. Then wake up to my mom checking on me, sleeping again. But yeah, there was about 2 or 3 days to where I don't remember anything really.
This is all the 2018 incident. Went through the similar thing again in 2021. Next, Shane. So we got the baseline. Let's compare Gray with Blaine. So Gray's 1 day, but he's semi-comatose at home. Blaine's hospitalized 4 days. Blaine's calcified liver transplant. Neither Gray nor Blaine had it. Dr. Hudson says Gray has permanent injury. Middle one in there, Shane. So I would think that's about the same, being honest. I think that's about the same. Whatever the baseline is that you come up with, he's probably about even with the baseline. Lorenzo Munoz. Okay. So let me tell you about Lorenzo. He was 24 years old when he was admitted to UMC. But look at this ammonia. Remember I told you about the 140 being high? This guy had 200. Normal is 32. He had 200. So hepatic encephalopathy, again, that's brain swelling. They diagnosed him with acute liver failure, encephalopathy, altered mental status. And there's the ammonia connection. So he was so confused, he was calling out in the hospital, and at home, I guess. He was calling out to people and seeing people that weren't there. And he told you a little bit about this. Oh, first of all, let me show his ASTs. 1200, 1772 for the AST. Elevated. Go ahead, Jim. And again, he had a 6.5 INR, and So anything above 4.9 is life-threatening. So they transferred him to UCLA for liver transplant. You know, there were a number of people who went on the airplanes. Daisy went, Lorenzo went, Trevor would have gone, but his spleen was too much. But he actually went, okay? So they sent him to UCLA. Here's a picture on the flight. Okay, next. A little close. Next. Okay, here's what he told you.
Do you have any recollection of being transferred hospitals?
I have very, very fuzzy, short recollections and memories of that. Yes, I believe I remember my mother telling me that I guess they can't do anything here, and that we're gonna have to fly you. And gosh, I think I remember seeing her sign papers for the flight or something like that. But I remember her saying, next to my side, saying, "Son, we're gonna have to fly you because they can't do anything about it. They can't figure out what's wrong with you." And I have 2-second recollections of on the flight with my mother next to me, being rolled down the hall at UCLA, and then just being poked and prodded and flopped around like crazy.
And I think we have a picture of UCLA. There he is. Not in very good shape. This is the liver transplant form that they had to sign. You know, the mother authorized the liver transplant. And they say right here, you can die because this is a very complicated operation. It takes 8 to 12 hours. You have a surgical team of 20 to 30 people. Very complicated operation. Because you're taking out your liver that you were born with, you're putting in the liver of a stranger. So it's a very complicated operation. Okay. They kept him for 5 days, and he got better. So they let him go home. So he's in UMC, sent by emergency jet to UCLA. Ammonia level 140. I think that's actually 203. Basically comatose. He was in a coma. Saw people there, couldn't tell who they were. They signed a transplant form. It took him 3 years to find out what the poison was that caused his injury. So let's compare him with Blaine. So he's in a coma because of the 140 ammonia. Blaine's delirious for several days. They're both counseled, but Lorenzo was actually flown to UCLA, and he also had a liver biopsy, and he has permanent liver scarring. So I think he's way, way above whatever Blaine's baseline is. Okay, now here's the next plaintiff. This is Sherry Rasmussen, and again, I think you may remember she's the professional skater. Okay, she was a professional skater for years, then retired. She was a Clark County school teacher. So she had the same acute liver failure as the other plaintiffs, but her vomiting was magnitudes higher than most of the other ones. So let me just show you some of this. Intermittent vomiting for several months, episode of vomiting. This is the hospital record from June 6, 2020. Next, Shane. Okay. Worsening nausea over the past 2 weeks. No vomiting since Saturday. Vomiting on Saturday. Vomiting. Okay, next, Shane. That's August 11th, 2020. So, again, she starts vomiting in April 2020, and now we're in August. Next. The patient presents with vomiting, and patient is a 59-year-old female. Patient has a long-standing history of cyclic vomiting syndrome. Okay, I guess you vomit blood 6 times a day, and the doctors have a name for it. And here it is, cyclic vomiting syndrome. And again, the reason she was vomiting is because she's got the toxin in her body's trying to get rid of it. So she is vomiting so much that she is vomiting up blood. Not just one day, not just 1 week, not just 1 month, but 8 months of vomiting blood, sometimes 6 times a day, okay? And again, this is past pain and suffering. This goes into the category of past pain and suffering. Next.
I just noticed that I just kept getting more and more and more nauseous, and as time went on, the nausea got so much more intense, and like pain, just really bad pain in my stomach. And I just couldn't eat, I couldn't drink.
We got another one, Shane?
It just kept getting worse and worse. I just kept throwing up more and more. I think that might have been when it started going more to like throwing up 3 or 4 times a day, something like that. But there was no let up. It just would not let up.
Throwing up 3 or 4 times a day for 8 months, okay? Throwing up blood. Okay. That was her nightmare. All right. This is yet another medical record. This is from November 21st, 2020, so I think we're at 8.5 months now. Generalized weakness and fatigue and hematemesis. That's throwing up blood. That's the fancy-dancy word for throwing up blood, okay? And because she was throwing up blood, she got another little treat, okay? They did 8 different colonoscopies on her during the 8-month time period. They scoped her 8 different times looking for something. Go ahead, Jay.
Nothing. They couldn't figure anything out. They sent me to a GI doctor, Dr. Tabaldi, and for the next several months, almost a year completely, I was scoped 8 times. 8 times. Because I not only was vomiting, but I was vomiting blood. Which terrified me. When I saw blood in the toilet and I collapsed on the bathroom floor one day, and that was one of the times the ambulance came to get me. I just thought I was dying. And I was so scared I was going to look like kids who need me. And I just didn't know what was happening. And then when I went to the hospital.
Okay, they sent Sherry down to UCLA. She didn't get the emergency jet like some of the others got. She just had to drive down herself because they weren't focused on a potential transplant. So she went down to UCLA. She was hospitalized there for 5 days. Go ahead, Shane.
It was so traumatizing to not know what was going on, and going to a doctor after another and being sent to UCLA and thinking that I had cancer and it didn't, and nobody could tell why I was so sick, and I was losing weight all the time, and it was a nightmare. I such a think about not being here for my kids.
Okay, again, here's the baseline from Blaine Jones.
Were you able to eat normally?
No, except for when I went to UCLA, which I'm not sure why this is. I don't really understand why, but when I went to UCLA, my then husband and I went, he took me, and we were there for 5 to 7 days, and I wasn't nauseous.
Gee, what a surprise. You drink the good hospital water for 5 to 7 days, and all of a sudden you're not nauseous. Okay, this is the baseline from Blaine Jones. Let's compare Sherry with Blaine. So Sherry had multiple hospital visits. I think she was the only plaintiff that had this wonderful colonoscopy procedure. Blaine sick for 4 days. Sherry vomited blood for 8 months, sometimes 4 times a day. I think Blaine did vomit. Blaine Blaine was counseled about liver transplant, Sherry wasn't, and Dr. Hudson says that Sherry has permanent liver injury. So I think, all told, I think just the time here, the 8 months, Sherry should be more than whatever the baseline is. Okay, Daniel Taylor. So again, this is the slide I showed you during the opening. Daniel's the automobile mechanic. He's hospitalized May 18th through May 24th. Again, he's sick about 2 or 3 months before this. Super high ALT, ASTs. He had the super high INR 8.08, so he had the second highest one. I think Daisy was highest at 9.99, but Daniel had the second highest one. And then acute liver failure and encephalopathy. And I already played you the clip about how they brought his children into the hospital to say their final goodbyes. But I want to play a clip of before he went to the hospital. This is his description of what was happening before he went to the hospital.
I believe the nausea came on stronger, and I had never felt like that. I felt like someone slipped me a bunch of sleeping pills all of a sudden. I just felt like all the energy was draining out of my body. And I remember I had to pick up my kids, I believe, from gymnastics. And on the way there, on the way back, I realized I shouldn't even be driving. I'm kind of swerving off the road, and this is not good. So I ended up making other arrangements for them the next day, stayed home, didn't work, and just everything started getting worse and worse.
Okay, this is a Mountain View record, 40-year-old male, altered level of consciousness, acute liver failure. Next gen. ALTs, ASTs, high like everybody. 8.08 on the INR. Next gen. This is when he confirms that they told him that potentially he needed to have a liver transplant. Go ahead.
Were you aware of the need for a potential liver transplant?
I was.
Okay, and the reason he needed a liver transplant potentially is because he had the high 8.08. Okay, let's go to the baseline.
And the doctors, they were basically asking me if I had a will. And I said, yeah, actually I do have a will.
Let's cut that.
And they instructed.
I think I played that one. So here we have the baseline. Again, this is Blaine's baseline, 10 million. Okay, so both of them 5 or 6 days. Daniel's 6 months before. Blaine went to hospital right away. Both counts about liver transplants. Neither one had it. Daniel had really high liver function tests. We don't know what Blaine had. And Dr. Hudson says Daniel has permanent injury. So when you compare the two, I think more for Daniel because he's got a longer illness and he's got this real high INR. Okay, Mr. Watkins. So Mr. Watkins, he's hospitalized back in 2018. Remember, he's the one that got, lucky him, he went to hospital on his wedding anniversary, so he got out of buying dinner. So he general weakness, falling down at the house. They take him to St. Rose, and they won't check him into St. Rose, so they gotta pull some strings to get him into Desert Springs. So he's at Desert Springs, and he's got the same mental confusion everyone else does. I feel my brain is not working. Next gen. High ALT, AST, next gen. Ammonia level 40, not as high as some of them, but remember normal is I think 27, so he's up there. So here's the diagnosis when they discharged him. Acute hepatitis, which means acute liver failure. Elevated INR, falling down, slurred speech, impaired liver function. And this is how Steve described the problems that forced him to go to the hospital.
Well, it was a graduation party, and I went into their home, and he was, at the time, he was the captain of the fire department. His daughter was a Henderson cop. And they looked at me and said, "Dad, you don't look good." I said, "I'm kind of dizzy." And I said, "Yeah, you need to go home." So driving home, I kind of wasn't joking, but I was telling Dustin at 12, like, "You might have to drive my truck, take me home." But I made it. Got home, and I went right to bed. And so when I went to bed, I just remember waking up. It was like an out-of-body experience that I had. I thought I had a stroke. I couldn't see. It was like I can see this way, but I can't see in my pupils. It was really blurry, and I couldn't hardly talk. I was weak, and I just laid there. All I wanted to do was sleep. And so I was just sitting there just waiting for my wife Jerry to wake up, and she thought I was still sick. She got up, she left me there, and thought I was just sleeping. And when she got back from work, she noticed that I was still in bed. And then Destiny and Jerry tried to put water as I was laying down. I just remember this. I just felt water going all over my jaw, and I'm like, oh my gosh. And thinking to myself, I couldn't communicate with them. Thinking to myself that they're going to drown me, and they were putting real water in my mouth. And then they're like, Destiny says, Poppy, you need to get up. I couldn't get up. I couldn't communicate. And then, that's when, they picked me up along with a friend of ours and took me to the hospital.
Okay, one more clip. This is after he got out of the hospital. Again, he lost 50 pounds. Remember Hunter told you how much weight he lost? Here, go ahead.
After you got home, did you lose weight?
Well, actually in the hospital, I lost about 50 pounds. And when I got home, underwear, nothing fit. It's just like, it was, yeah.
You mentioned you fell before you went to the hospital. Did you have any instances of falling after you got home from the hospital?
Well, I fell another time when my legs buckled, but I didn't stand for a while because, I certainly didn't want to get hurt.
Okay, next slide, Shane. So these are all the points we just went through. His injury was May 2018. It took him 3 years to find out that real water was the poison that put him in the hospital. 3 years. Okay, so let's compare him to Blaine. So they're both hospitalized the same number of days. They both had big falls. Neither one had biopsies. Steve had severe mental confusion. They both had elevated LFTs. Dr. Hudson says Steve has permanent injury. I would say that they're about the same. Okay, next, Daisy. It's Daisy Wheat. This is one of her hospital records from St. Rose on June 2nd, 2020. Worsening confusion, dizziness, foggy in mind, emergency room, noted to be acute liver failure, elevated ammonia level, all the same symptoms. Next, Shane. Here's her ASTs, again, normal 78. Next. There's her ammonia level, 126. Normal's 31, I believe. Next. I think that's just the next day. Oh, back to that one, Chief. So that's what I want to point out, INR. She had the worst INR, international normalized ratio, that's the clotting ratio. She had the worst one of any plaintiff, okay? And that's why they got her on a plane and they flew her to UCLA. Next in. So here was the diagnosis in her first hospitalization. Acute liver failure, encephalopathy, brain fog, jaundice, drug-induced liver injury. They knew it was a drug, but they didn't know what it was. Next. And here's Daisy's testimony about the first night she was in the hospital.
And what do you recall from that first night in the hospital?
Well, when I got to the hospital, he told me about my liver failure, whatever, and then my family came. I was so sick that I had to sign a power of attorney over to make choices. So my sister did that. I think I remember signing something. And then they left. And then I couldn't feel my legs. They were numb. hands were wiggly, and I was seeing things. Seeing things in the air, flying in the air, and then I just felt it took a lot of energy just to breathe. So if I were to lie back or something, I thought to myself, I was gonna wake up. So I just started pinching myself, just so I could feel my body. And I said a prayer, and I said, you know, God, I'm not ready to leave yet. So I called my friend, Bo, sitting there, and I said, in case I die tonight, I love you, and I tried. He goes, don't talk so silly, and just said that I'll be back in the morning. And I was too afraid to go to sleep, so I just, yeah. And somehow I fell asleep. I don't know how I did. The next day, I just don't remember much.
Okay, fear of dying, again, that's a past damages item. All right, so they sent Daisy to Loma Linda by an emergency jet, and they were considering giving her a transplant in exchange. This is her tissue slide. So remember, Dr. Dadno told you blue is bad. So there he is. Well, go ahead, Dr. Dadno.
Okay, what do you see on the October 3rd, 2020 slide?
Here you can see the fibrosis is extremely extensive. Full area, full area, full area, full area, full area. You can see the excess fibrosis in the full area, and the bridging is absolutely extensive. And this is another one where I'm not seeing 100% surrounding the nodule, but I'm highly suspicious that this is a full, that it's at least a full.
Okay. And when you say highly suspicious, it's more likely than not?
Correct.
But not 100%?
Not 100%.
Okay, more likely cirrhosis. Okay, that's the standard we have to meet. And if you remember, Dr. Robbins pretty much agreed with this morning. Dr. Robbins agreed with it. Here's the dates of Daisy's hospitalizations. She went to 4 different hospitals. So she's at St. Rose, Loma Linda, back to St. Rose, then back to St. Rose again. So she's on a 5-month odyssey. All right, next. And I just wanted to play this because she went to the emergency room over and over again. She went to the hospitals over and over again. She must have been into the hospitals or the emergency room 10 or 11 times. Go ahead.
And what was this like, your 7th, 8th, 9th, 10th going into the hospital?
I lost track because I was still consistently feeling sick as a dog. I couldn't do anything, couldn't focus. I just was so hopeless, I felt. I barely ate. I lost like 12 pounds from the time I got sick till that point. And I just, yeah, same thing. I was, yeah.
Okay, next is chart ship. Okay, we'll compare to Blaine's baseline. Go ahead, Chief. So let's compare Daisy. These are the hospitalizations of Daisy. Here's the baseline. So she goes to the hospital a dozen times. Blaine's in for 3 days. 2 liver biopsies, Blaine none. Flown to UCLA for the liver transplant, Blaine wasn't. And Daisy has cirrhosis, permanent liver scar. Blaine's condition is unknown. And Daisy was sick for months, Blaine was sick for days. All right, so I think Daisy, whatever the baseline you determine, is much, much higher than the baseline. Okay, last but not least, Brandy Wren. Brandy is the bartender. Remember, Brandy told you she was the bartender? Okay, so she's a classic example of the real water circle of repeated poisoning. Remember we went through this? They drink the poison, they get sick, they go to the hospital, they drink the good hospital water, they get better, and then they drink the poison. Around and around and around it goes. All right, Shane?
Now I'm unresponsive Saturday, I'm unresponsive Sunday. And then now all day Monday I'm unresponsive. My best friend comes in, she sees me, she calls the ambulance, then she calls my mother. And she said, I just can't, I have to take her, we have to go. So they called the ambulance. But I guess I told them I'm good and I can walk down the hallway. I thought I could walk down the hallway. And the last thing I remember is driveway and I can kind of see the corner of my house, and then I hear a loud bang, and I start, you know, and it's the paramedic, and I can see that I'm inside the ambulance. And he like put his hand on me and he said, "Do you know where you are?" And I said, "Yeah." And I don't remember anything after that. But apparently it was a big show at the hospital.
So she's in the hospital for 6 days at the Henderson Hospital. This is a record from the Henderson Hospital. So 45-year-old female, same symptoms, throwing up, vomiting, liver failure. Her iron hour is 8, and remember, 1's normal. So she was counseled that she may need a liver transplant, although she wasn't flown to LA. So the first thing they did is they did a wonderful liver biopsy, and this is Brandy's description of the liver biopsy.
They bring me to a small room, no bigger than your jury box, probably half the size of that. And they take a needle with just the needle part is that long. They make you lift your arm up so that you can open up your rib muscles. And they did 4 biopsies, which you are absolutely 100% awake for. And is that painful? I'm going to go ahead and say that the fear outweighed the pain in this situation. You are more afraid of what is they're going to find and why you are there, because you still don't know. You know, these doctors have been talking to me for 7 days. I've taken every single test I could possibly take. Bilirubin, this, that, and I'm Native American, so like, could that be a cause? You know, like your culture even is in question here. You know what I mean? So like every test, every question, drug testing every day. So no, I have no idea what's happening there at the end of a liver biopsy. You don't know what to expect.
Okay, Dr. Dad now explain to you what the liver biopsy showed. Next.
How many ordinarily show bridging fibrosis in this slide?
Everyone that I'm looking at, that's on the slide.
And how many is that?
1, 2, 3, 4, 5, 6. At least 6.
Okay. And how would you grade this bridging fibrosis?
3 out of 4.
Okay, and again, you don't have to take Dr. Dadno's word. You can see the slide yourself. You can see the blue on the slide yourself. So she was considered for a possible transplant, but after 7 days in the hospital, her liver function test got better, and so they didn't transplant her. But she has permanent liver injury. Permanent liver injury. Okay, that's the discharge diagnosis. Pretty much the same as everybody else. So next, Shane. So we're comparing Brandy to Blaine Jones. So Brandy's sick for months, Blaine for days. Brandy's vomiting over and over again for months, Blaine for days. Brandy had the liver biopsy, Blaine didn't. Brandy had the INR at 8. You know, they almost sent her for a transplant evaluation. They didn't. We don't know what Blaine's was. And Brandy has cirrhosis, permanent liver scar. Blaine's condition's unknown. So Brandy is much, much higher than whatever baseline you decide is appropriate. All right, so let's go to the second part of the verdict form. I'm almost done, ladies and gentlemen. We'll get a break after this. So the second part of the verdict form, this is future physical and mental pain, suffering, anguish, disability, and loss of enjoyment of life. Okay, remember I told you everything from the date they first started having problems to now, till now, that's past. This is future. Okay, so, and same kind of thing. So, future damages are a little more difficult to assess in this case than past damages, because there's no study in the world that's been done on people that shows what happens when you drink rocket fuel for months or years. Okay, there's no study. You know, we know what happened to the rats, they all died, but there's no study. All right, so you know, I think Dr. Alsina was pretty candid He said all these people are permanently injured, but we don't know what's going to happen to them. That's what he said. And so we don't know what's going to happen to them. But we do know one thing for sure. Okay? We do know they will have fear. They will have anxiety about their future. Okay? And that is, back to the top, Shane, that is a compensable damage. So we don't know what their future physical, mental, or physical damages are going to be. We know what they are now. But we do know that they will have fear in the future. And let's talk a little bit about fear, okay? Next, Shane. H.P. Lovecraft, I read a lot of science fiction, I don't know why, but H.P. Lovecraft was a big science fiction writer in the 1920s. And Stephen King is one of the biggest, if not the biggest, Lovecraft fan. Okay, this is what Lovecraft wrote. The oldest and strongest emotion of mankind is fear. And the oldest and strongest kind of fear is fear of the unknown. So the strongest emotion is fear, and the strongest kind of fear is fear of the unknown. And all these people have fear of the unknown because they don't know what their future holds. Okay, they know they're permanently injured. They know some of them have cirrhosis, but they don't know what their future holds. I told you about the animal studies. We know what happened to the animals. Okay, go ahead, Shane.
So then I looked at studies that had looked at not just animals getting a single high dose, but getting lower doses over a period. And one of the studies that was published was done with Germany in 1988. And they actually, in this, they gave male and female rats different doses of hydrazine in drinking water. Okay? They gave it to them in the drinking water. And they gave it to them over the course of greater than a year. And then when the animals died, they did autopsies on the animals. And they had started this study because they thought they wanted to look at whether hydrazine caused cancer. It turned out it didn't cause cancer, but one of the things that they found was that it caused an increase in the prevalence of what's called bile duct hyperplasia, or a thickening or abnormality of the bile ducts. And those are an important component of the liver. So this was an example of how chronic exposure to hydrazine at lower dose that didn't kill the animals right away caused them to develop abnormalities in the liver.
So that's exactly what we have in this case. Chronic exposure to hydrazine at a lower dose. And I'm not suggesting to you that you should give plaintiffs compensation for potential deaths, that they're going to die. And Mr. Parker will talk about Mr. Henry, he's a different class. But I'm not suggesting that. But I am suggesting that these people all have a reasonable fear of the unknown. So we know 4 things for sure. We know that when you gave this rocket fuel to the rats in low doses for greater than a year, and most of these plaintiffs drank it for greater than a year, the rats died because of liver problems. We know that they haven't done studies on humans because it would be unethical to do that, but we have the 2 case reports that I already talked about. People, they died. They died of hydrogen exposure. So all the rats died, and these 2 people died. We know Dr. Hudson believes the plaintiffs have permanent liver injury, and all the plaintiffs fear the unknown in their future, justifiably so. And let me give you a concrete example. Hunter Brown told you about his fears and anxieties from drinking rocket fuel. Go ahead.
I'm okay. It's tough to think that I'm going to have to, go to the doctor for 20 years and get monitored for the next 20 years. It's not good to think that I drank a carcinogen for 2.5 years. And what's that going to do to me 10 years from now, 20 years from now?
Same kind of fear from Monica Branchinoto. Go ahead, Jim.
So now I'm like, could this happen again? So now I'm scared. So I didn't want my younger son to come home because I didn't know if maybe there was something going on in my house. Maybe there's some kind of lead or I don't know, it's something. I would have never in a million years thought it would be water. So those few months, you know, I look at my future, have young kids. I want to have grandkids. I don't know if this is going to happen again, and the next time it happens, am I going to die? So that was always what I thought about in the back.
It's unknown what's going to happen to these plaintiffs in the future. And fear of the unknown is the greatest fear. And that deserves compensation under the future damages. Thank you, ladies and gentlemen. I appreciate your attention. I think we're going to take a little break. I'm kind of predicting what the judge is going to do. And then Mr. Parker's going to get up and talk about Mr. Henry a little bit and punitive damages. Thank you.
All right, thank you, Mr. Kemp. And I think we're ready for a break. Is that correct? Yes, I can tell. Remember, ladies and gentlemen, you're admonished not to converse amongst yourselves or with anyone else on any subject connected with this trial, or to read, watch, or listen to any report of or commentary on the trial of any persons connected with this case, or by any medium of information, including without limitations, newspaper, television, radio, social media. And last, do not form or express any opinion on any subject connected with this trial until the cause is finally submitted to you. I will take a break. Mr. Marshall.
All rise. Jury's clear. Please be seated.
Okay, thank you, sir. And counsel, can we approach?
Only a few left.
When you get us.
right, do the parties stipulate to the presence of the jury?
Yes, Your Honor.
Yes, Your Honor. Okay, Mr. Parker, sir.
Thank you, Your Honor. May I proceed, Your Honor?
Yes, you may.
Thank you. Good afternoon.
Good afternoon.
Good afternoon. Ladies and gentlemen, when we first met, October 7th, 2 Mondays ago, I explained to each of you that this case would present you with the opportunity to make a difference. Hopefully you remember that. I said you can make a difference individually, you can make a difference collectively as a jury. And I said that difference would help not only punish Real Water for what it did to these plaintiffs, but more importantly, prevent any other company in this industry from committing the same conduct. You recall me saying that. And I told you how important this case would be. We know now, and it's not for me or Mr. Kemp or Mr. Adu, we know based upon articles taken by people who are not involved in this case, with no dog in the fight, published articles, that we have people that have died, people that have had liver transplants, people who have permanent injuries, scarring. We know all of that. And we know it because of slides from biopsies. We know it based upon the articles. We know it based upon medical information and scientific information that we've received. You don't have to rely on Mr. Kemp's word. You don't have to rely on Mr. Adu's word or even mine. We've put it in front of you. And I said early on, I don't want you to have to make a decision based upon what I say. I wanted to put the evidence right in front of you because I wanted like-minded, fair people to make a decision in this case. That's why that process of voir dire took 2 days. Because we wanted you to come with unbiased positions and make a decision based upon the evidence. I want to show you jury instruction number 25. You could, Shane? Because I want you to keep this jury instruction in your mind as you consider my closing comments. And this is jury instruction number 25. The judge read it to you. And it tells you that punitive or exemplary damages are to make an example of or punish wrongful conduct. And it talks about the amount. In terms of the amount of the damages, that's for a different time. But for today's purpose, I want you to understand this jury instruction so that you understand and consider the evidence as I pointed out to you and why it proves unequivocally that Real Water is guilty of oppression. Go up, Shane. Implied malice and conscious disregard. And I point to conscious disregard at the bottom because it says it means the knowledge of a probable harm, consequences of a wrongful act, and a willful and deliberate failure to avoid those consequences. Real Water knew since 2013 of people getting sick. They received notifications in the form of emails, texts, customer complaints. They knew. And despite knowing, what did they do? They didn't test. They didn't investigate. They gave free water. That was their answer. And as Mr. Kemp was speaking about this vicious circle, it kind of took me away from my planned closing, and made me think about the people that got sick and got free water, which eventually just made them sicker. The people who are in the hospital, they leave, they're thinking they need to hydrate, they get sicker. Everything that Real Water did was a plan or a scheme to ensure that their bottles just kept leaving the plant. That is the quintessential definition of willful and deliberate failure to act to avoid those consequences. It couldn't be plainer. For 3+ years, since 2021, since 2021, this lawsuit was pending. And in those 3 years, Rio Water refused to admit that its product had a known liver toxin in it. It wasn't until 13 days before we met you that this court determined that that product was unreasonably dangerous and defective. Bless you. And in that time, Mr. Kemp has gotten a cold. But ladies and gentlemen, these plaintiffs have gone through 3.5 years of litigation, 97 depositions, retaining an army of experts to prove something that Rio Water should have known from day one.
Your Honor, objection. May we approach, please?
Yes.
Your Honor, may I continue, Your Honor?
And counsel, thank you for your assistance. Yes, you can.
Thank you. You ready to go, ladies and gentlemen? Now, what we've also learned, ladies and gentlemen, is that Dr. Hudson reviewed the Loma Linda report. Dr. Hudson reviewed the MMWR report. Dr. Hudson and Dr. Datnow reviewed the slides from Severin, the 22-month-old baby. They reviewed the biopsies from the plaintiffs here that have had biopsies. They reviewed the biopsies that are part of the Loma Linda report, like I said before. And of those roughly 10 biopsies, all of them showed some form of injury. The majority of them showed permanent injury, fibrosis. There was one in the Loma Linda report that showed inflammation. But all of them showed the effects of this toxic on their livers. And so when Mr. Kemp was speaking about permanent injuries, everything that we have today, every bit of diagnostic evidence would make this scale fall over. And I ask you, I want you to think about it. What experts did Rio Water bring in that had a biopsy that showed there was no damage? So when Mr. Kemp was talking about the preponderance of the evidence, that's all we have to show, the butterfly weight on that scale. We've shown an elephant on that scale. Now, if you could, go to slide number 1, Shane. Number 2, rather. So we know that Rio Water has consciously disregarded the rights and safety of infants, children, teenagers, adults, and seniors. We know that. We know we have deaths, just like we spoke about earlier. Next slide. We also know the rule of this case is that for those who manufacture, distribute, and sell a defective and unreasonably dangerous product, they have to be held responsible for that. And we know Rio Water did all of those things. Next slide. These are the 18 complaints going back as far as 2013. And we went over them. I'm not going to go back over them. I just wanted to highlight this list of complaints in your memory. So you can think about it, as I said before in the punitive damage instruction, that they disregarded each one of these. The chemical smell, the fishy smell, the fuel or gasoline-like smell, which we learned from Dr. Najim. When you have hydrazine in high enough quantities, that's what it smells like. They ignored it. Next slide, Shane. We also learned that this concentrate that was tested by the FDA was considered adulterated by the FTC. Next slide, Shane. And when you look at the word adulteration, it's defective, it's unsafe, and it's filthy. That's the definition of the fluid that these plaintiffs were drinking. Filthy. Next slide, Shane. Hydrazine. All 3 tests. And Dr. Najim said some of the highest tests he's ever seen of hydrazine in a product. Next slide. Dr. Najim said that these 2 readings were so high they had to dilute them to test them. That's how high the hydrazine levels were. And this was 2 years after being produced. He said it's probably up from 2 to 10 times higher when they first produced it. Not a single test before these products were put on the market. Next slide, Shane. This is the MMWR. I want to just show you the first page before we get into it. And I'll be quick about this, ladies and gentlemen. 5 children from 7 months to 5 years, I'm sorry. Real water, the concentrate, all the 5 children shared exposure to the real water. Real water offered a variety of products, 5-gallon, available in smaller bottles, nationwide. Not just in Las Vegas, nationwide. So when we put those complaints, the customer complaints on, we actually had some by video, from Tampa to Oregon, Southern California, across the country. Next slide, Jim. This again is an account from the MMWR about the lady in her 60s dying from real water. From babies to elderly, and everyone in between. Next slide, Shane. I want you to see the peaks, just to keep that in mind, because you're going to see the peaks with our clients on it next. Or 2 slides down. Go right ahead, Shane. I bring the Loma Linda report up, just so you can see it again. But I want you to understand that more than 4 were at issue at this point. They had 11 probable cases at this point early on in the Loma Linda investigation. Not just the 4 they did biopsies on, but 11. Go right ahead, Shane. We know we had liver biopsies, Shane. Now, everyone here had real water longer than 2 weeks. And the person with just 2 weeks of exposure had paracellular fibrosis. Just 2 weeks. The 5 babies, 22 months, they're drinking real water in their formula, in their bottles. 9-year-old Trevor Abely is drinking it as a kid, trying to become an athlete. I mean, everyone has been affected. And from 2 weeks to 2 years, bridging fibrosis, permanent scarring, periportal fibrosis, permanent scarring, pericellular fibrosis, permanent scarring. Again, inflammation. Next slide, Shane. Thanks. And here's the pictures. You see the blue? I won't go over it much. We know blue is bad. And it's here in the Loma Linda report. Again, Loma Linda is not here on trial. They have no dog in this fight. This is unbiased scientific evidence. Next. And here go all of our clients here. It's amazing how these peaks line up. Next slide, Shane. And in addition to the Loma Linda, in addition to the 15 here, in addition to the 11 additional probable causes pointed out in the prior article, you have 2008, no testing for toxins. You put the product on the market without testing for toxins. Known liver toxins pointed out by the CDC in this report. We have customer complaints, 2014, 16. We have the NSF HACCP comment. We have the failed HACCP audit. We have Anthony Randolph in October begging Blaine Jones, do a recall, do a recall. It's the water. You got sick, my nephew got sick, a friend of the family got sick. Do a recall. If that's not a conscious disregard for the safety of others, you can't tell me what it is. He's hospitalized October 5th. And yet, he pushes to Anthony, we're not going to do a recall. In fact, we're going to try to sell more of this concentrate. That's his response to his director, VP of distribution, telling him we need to do a recall. And we also know, of course, 5 children And in addition to this, we find out from the FDA investigation, 25 to 30 complaints. All of this is just building, more and more people, and their health, their safety, their medical conditions are being ignored because they want to keep that product going. And you heard what Mr. Desatel said, and you'll hear it later. They told him not to stop that line because that was more important than the safety and health of these people or anyone else. Next slide, Shane. I gave I presented this slide to you in my opening. And I want to remind you of how these dates line up. March 16th is when the FDA came in. Plaintiff's complaint was also filed within days of that. And they finally did a recall after the FDA comes in, when the federal government makes its move. Trial begins here with the testing. Next slide, Shane. The 97 depositions I was speaking of, there's no dispute of that. Next slide. This is Dr. Goldsmith that I spoke to you about. Real Water hired him as his epidemiologist, but Real Water didn't bring him in to sit on this stand and testify before you.
Objection, Your Honor. Should we approach?
Yeah.
Mr. O'Doul.
Thank you, counsel.
So, Dr. Goldsmith is an epidemiologist, and he was retained initially to review and investigate this Real Water issue from an epidemiological standpoint. And he determined that when Real Water retail bottles were found to have hydrazine, in addition to the concentrate, that was the smoking gun. Let's go, Shane, let's see what we have to say.
Do you have any information as you sit here today that would tell us whether those retail bottles with the hydrazine you just mentioned had hydrazine above the toxicity requirement?
No, I mean, this is what they reported, and they should have had 0. The fact that they had above the limit of detection, at least 4, if not 4, at least 4 out of the 5 positive, says to me that, I don't want to use this term, but this is the smoking gun that we, concerned with the epidemiology and field investigations, and this matches up with what the FDA chemists found too in other samples of the concentrate that, again, notwithstanding that there may be other contaminants that are detected or found, but this does appear to me to make it much more of a company-wide kind of a concern. And it says also to me that the 5-gallon containers appears not to be the only source of the contamination. This tends to give me a fuller picture, and it suggests clearly to me that the toxic exposure possibly leading to acute liver failure was not solely confined to the 5-gallon home delivery side of the business.
So now, this epidemiologist has determined that the retail bottles, the 5-gallon bottles, they all had hydrazine, should not have had a drop in it, and has led to acute liver failure. Now, what Mr. Kemp has done is he's gone through with all of the plaintiffs their medical history. and what has gotten them all here, and how they endured hospitalizations, vomiting, time away from their families, the fear of the unknown, the biopsy, more and more and more things that they dealt with as a consequence of drinking real water. Let me tell you about the Quantes experience. Next slide. One more. So, Quante was born in 1997. He was 24 when he had this liver transplant. Before that, he graduated from Western High School. He went into the construction field, as many people do here in southern Nevada. And when construction slowed down, we know that there was a period of time when construction slowed down here. He became an armed security guard. And at age 23, it's the first time you can ever see related to acute liver failure, he found out that he had elevated liver function tests and may have a very serious liver problem. He was jaundiced, yellow eyes. He had elevated AST and ALT scores. They couldn't figure out what was going on. Eventually he left, returned to Mountain View, spent several days there. They couldn't figure it out. Again, his INR is 5.14. AST, ALTs are all elevated. Same with Mountain View. Eventually, he's taken from Mountain View on June 15th, taken to the Keck Hospital at USC in Los Angeles. At this point, he's in end liver stage cirrhosis. And they find out, now this is the nephrology consult. There are several doctors looking at it. Findings most likely related to acute liver injury related to real water. That's what those doctors discovered. Next slide, please, Shane. Again, the massive amount of blue. Every doctor who's been involved in this case agreed that his liver was done. He was not going to live much longer. With this liver, he had to get a liver transplant if he wanted to live any longer. There's no dispute about that. Next slide. Next. While at Keck, he does the liver biopsy. Again, confirms just how bad a shape this liver is in. And that doctor, those doctors, Dr. Kim, meets with other hepatologists. They have a liver conference on June 24, 2021. And again, findings most likely related to acute liver injury related to real water. Because now in June of 2021, the information regarding a recall of real water is in the public domain. Now just imagine if that information had been in the public domain in the beginning or the summer of 2020. The children would have been in the hospital. 10 of the 15 plaintiffs would not have been affected by it. 10 of the 15 plaintiffs had injuries in November and December of 2020. That's conscious disregard. Next slide, please. Again, this is a repeat, but it just shows the biopsy. Next slide, Shane. And that's the result. That's the result of conscious disregard. Liver transplant, I don't know how many staples, horizontally or vertically, but that's what comes from conscious disregard. Next slide, Shane. Now this is what is amazing to me. We had this conversation with Dr. Alcina earlier today, and you heard his testimony. The 1-year, 5-year, and 10-year survival rates of orthotopic liver transplantation recipients, 84, 68, 54. Now he's gotten beyond, at this point, 4 years almost. 3.5, 4 years. expectancy based upon Dr. Hudson's 35 years of experience is 12 to 15 years. Dr. Alsina said 10 to 14. Today he equivocated between 14 and 15. No 24-year-old should be looking down the barrel of losing 16 to 32 years of their life. No one. Next slide. And this is DeQuante's testimony.
And do you know why you were transferred?
Yes, sir.
Can you tell the jury why?
At that time, they told me, you have to have a liver transplant. Your liver is basically dead. They had me on tubes and stuff, just basically keeping me alive. I made it to California, and I'm just sitting there waiting for a liver. Just waiting.
Did they indicate that you had an option? Was there, in terms of a liver transplant, did they say there was any other way of you staying alive and being healthy without a liver transplant?
Yes, it was either life or death. I had to take it.
24-year-olds should not be faced with making that type of decision. Really wasn't a decision to make. He only had one decision if he wanted to remain alive. But consider the position you're in when you're in a hospital and you have thoughts of your own mortality, but you're actually waiting for someone else to die, which is horrible. It is horrible to think that your life depends on someone else dying. When you consider what Mr. Kemp said about the fear, or either past or present, or future, I should say, the fear of not knowing if you're going to make it because you're dependent on someone else dying, that is a horrible thought. No one wants anyone else to die, and certainly no one wants their life dependent on someone else dying. That is a horrible, horrible thought. And he was in that hospital from June 15th to July 7th when he finally was released. Next slide, Shane. And so I asked him about his own mortality. Go ahead and play it, Shane.
Now, this is, and I apologize up front, Mr. Henry, I know this is a sensitive topic. Were you informed that because of having liver surgery, that your life expectancy would be short?
Yes, I don't really like talking about that because I'm young, but that's what I was told. Yes, sir.
And so he knows. He's sitting there right now. He's here. He knows, based upon two experts in the field, Dr. Alsina and Dr. Hudson, that there is no doubt, undisputed, that his life has been cut short. And it's either be a fourth of his life or almost a half of his life. And he knows that. And every day he's counting. Next slide, please.
And again, I apologize up front, Mr. Henry. Were you told that in terms of your life expectancy, that there's a chance within 14 years you may not be?
Sad to say, but yes.
I will tell you that he's taking it better than I would. That he's not, and you can tell, Mr. Henry Quante, he's not a person who is very emotional. And he did his best not to become emotional on this thing. But when you consider someone in their 20s, knowing that they may not make it past 38, that's past damages, that's future damages. And then there's going to be a loss of life expectancy that we'll discuss in a few minutes. Next slide. Now, this is Dr. Alsina, who we heard from today. We had some issues with the transmission, but I believe it's clear that he's agreed that DeQuante's life has been shortened and that he would have died if he did not have that liver transplant. Next slide. He's agreed that 50% of people after having a liver transplant don't make it past 10 to 14 weeks. Next slide. And there are a number of reasons why they don't make it. And I asked them about this, if you remember. People who have had liver transplants are susceptible to renal failure or kidney failure. Every form of every form, from skin cancer to colorectal cancer, pancreatic cancer, every form of cancer he's more susceptible to, and that's why there's a 50% chance he won't be around at the age of 38. He's taking anti-rejection drugs every day. You heard him say that. Because he has a stranger's liver in his body. That's not his God-given liver. And because of those anti-rejection drugs, he's now more prone to diabetes, hypertension. All the odds are against him. All of them. Next slide. Black males at the age of 25, now we rounded this up because he had the transplant at 24, but they go in 5-year increments. So we use 25. He should live to 45 plus 25 is 70. He should live to 70 on average. His best case scenario, complete best case scenario, he lasts till he's 54. That's if everything in the stars line up. But given what Dr. Alcina said, and given what Dr. Hudson says, the odds are closer to 38 or 39 than they are 54. So at a minimum, he's going to lose 16 to 20 years, or up to 32 years. And I remember him saying this when I was preparing this closing. I remember him saying he wanted to be strong for himself and anybody who has children and his children. That's been taken away. Real water took that away from him. Next slide. And those are the days. These are the years. And that's just math. Next slide, Shane. Now, the EPA says that hydrazine is a probable human carcinogen. When administered to various animals, hydrazine or hydrazine sulfate induce various lung and liver carcinomas, as well as mutagenic effects. These toxins should have been tested for when you create this new, bizarre form of making water. It's like testing, it's like creating a car or a plane and not testing whether it can drive, be driven safely, or fly. It makes no sense. But that's what Real Water did. Dr. Najim was an environmental engineer. He told us that GCMS equipment has been available for over 40 years. When he was still in school, it was available for Real Water to test it for these toxins. And Mr. Kemp told you early on, this was a $100 to $200 test. What I found amazing is that when Real Water questioned Dr. Najim, they were concerned about how the Russian titanium tubes may have caused the hydrazine. Real Water didn't bring their own environmental engineer to dispute what Dr. Najim said. His testimony is undisputed. Hydrazine was created in those Russian titanium tubes, and that every drop of Real Water contained hydrazine. He is never, this is what he testified, and this is a gentleman who does water quality for cities, states, towns, Coca-Cola, Pepsi. He said these were the highest concentrations he's ever seen. Next slide. Right there. If your client, ones you're consulting with, Coca-Cola, Pepsi, the city of Los Angeles, whatever, a town, a village, if you're getting one quality complaint, you advise the test.
It's a very easy answer, yes, of course.
And based upon your review of information, the information you reviewed in this case, did you see any GCMS tests performed by Real Water 2008, 2013, 2020?
Not that I have seen.
Next slide. Is there a benefit to testing quality of water?
It's the foundation of public health protection.
The foundation of public health protection. You're making a water product that you want people to buy, that you're claiming is healthier than tap water, and is laced with poison. Like I said when I first met you, ladies and gentlemen, during my opening, I said, you can live longer without food than you can with clean, safe drinking water. And that's why we had Dr. Najim come here and explain the importance of water quality and how this product comes to include hydrogen. So I want you to consider what Real Water did in terms of bringing witnesses before you. These are employees of Real Water. Michael Bush, production manager, Patty Converse, receptionist, who admitted she was unqualified to be director of quality control. Mr. Desitel, who said they never told him that he was a quality control director. They brought Mr. Mendigana, who's a line worker, which again, he had nothing to do with quality control. I still question why he was brought on. And then Anthony Randolph, the vice president of distribution, who told Blaine Jones, it's the water, do a recall. That's what you've been presented with from Real Water's standpoint. Next slide, Jim. Mr. Bush said, if you were to rate the water quality or the quality control at Real Water, he said 1 being the worst, 10 being the best, 3 or 4. That's what he said. Next slide, Shane. This is what Patty Converse said about her position.
All right, so the job in, Real Water job that was posted to Craigslist, was it for a specific position?
Yes, it was at the front desk, and from the front desk, I moved up within a month, I would say, to Director of Quality Control.
Okay. So prior to 2015, had you had any training with regards to how to make water, how to make food, and sort of? We'll get into what they taught you, but prior to 2015, no training whatsoever?
No.
Food processing?
No.
Water processing?
No.
Quality assurance?
No.
Nothing whatsoever?
Nothing.
Any chemistry class?
No.
Any involvement with using testing equipment?
No.
No training whatsoever. Next slide, Shane. And this is what she said about how she was informed on how to handle customer complaints. Shane?
Is this a complaint you got?
Yes.
All right. And did you investigate this complaint?
I took it to Blaine and he just said to offer them free water.
Okay, so when you received written complaints about your water causing someone an illness such as diarrhea, the solution was to send them free water?
Correct.
Okay, the solution was not to investigate as to whether the potential problem was the water?
Correct.
Continue.
Was there any investigation done in the manufacturing process at any time as a result of any kind of?
Absolutely not.
Again, clear indifference to customer complaints. No investigation, no testing, no nothing. People get sick, so what? Send them free water. That is a clear indication of how little Real Water was concerned about the public health and the health of its customers. Next slide, Shane. Now let's go to Jeffrey Desautel.
Okay, and, on a scale of 1 to 10, if you had to rate good and bad operations, how would you rate that?
0.
A 0. A 0. Not even a 1. That's how bad the director, supposedly a quality control, thought of the quality control at Real Water. Next slide, Shane. Mr. Diego Mendigana didn't recall who the director of quality control was other than a girl. I'm assuming that's Miss Converse. We don't know. He was never in the room where the concentrate was made, so how do you know what the quality control is where the concentrate is being made? And offered no opinions as to the quality control of how Real Water was made. That's who Real Water put before you. Next slide. And this is Anthony Randolph. Go ahead and play that.
So then, do you at some time form an opinion that the only similarity between these people would be Real Water?
Yeah, when I had a conversation with the owner's son, because I knew he was, became very ill, and it probably was in October, and I thought it was COVID, and they just didn't want anybody to know. But when my nephew and then another friend got sick, and then the phone calls that these guys were receiving in the office, then I asked the owner's son, his name was Blaine, I just said, I need to talk to you on a personal level. I know you were sick, can you tell me what happened? And he started describing everything that was going on, and it was identical to what my nephew and my brother-in-law best friend was experiencing. And so at that point, I told Blaine, I said, it's the water. I said, there's the only thing you guys have in common is you drink the water. Because even though my brother-in-law's best friend, comes around the family all the time, but he and my nephew don't really, they don't jive like that. There's a different age group, everything else. So at that point, I told Blaine, I said, you got to do a recall, man. There's something in the water. And that was probably beginning of November, something like that, middle of November, or whatever it was.
That is Real Water telling on Real Water. Anthony Randolph by himself has already proven that Real Water consciously disregarded the safety of the public, its customers, and even himself when he refused to do a recall, knowing all of these sicknesses. Next slide. Keep going.
Did you inform him that you heard through your conversations with the employees at the Anderson location that customers were calling sick?
I did.
So you laid that all on the table for him?
I did.
And you gave him the opportunity to be reasonable by presenting him with the recall suggestion?
That was just my suggestion, yes.
And what did he say?
He said no, because I first thought it was the water, but then I trying to remember everything that he said, trying to justify that it wasn't water, and then I just told him, I said, Blaine, listen, we're getting numerous phone calls, according to, I think the gentleman's name was Anthony as well. They're fielding so many phone calls, people complaining. I know people that got sick, you were sick, you guys don't know each other, so it has to be the water.
Yes.
And he just, I traced it back, it's not that mean, he just kept trying to justify it, so I just left it alone. I thought I did my part and brought it up and went from there.
We are getting so many calls at the plant of people getting sick. No investigation, no testing, no recall, no stop of production. And yet, Blaine Jones is saying, oh, I traced it back, trying to justify why he was not going to stop production. Again, like I said when we first met, putting profits and money ahead of public safety. Your own internal people are telling you this, and he refuses again and again. Next slide, Shane. Now, you guys might remember Dr. Hutt. Mr. Kemp did direct examination of her on Thursday, and Dr. Hutt is the only food science and human nutrition you heard from. She's one of the creators of the HACCP program. Next slide. She's worked for the federal government. She's worked for the Grocery Manufacturers of America. She's worked for several large companies you've heard of, all dealing with quality for food and beverage. Real Water's not brought anyone into dispute her testimony. You've not seen anyone on behalf of Real Water come here and say they had exactly what they needed to have in terms of ensuring safe drinking water. No one has said that because it's not true. They couldn't be. Next slide. This is, again, her history. Next slide. And these were her opinions. Real Water didn't have a quality assurance program of leadership for quality assurance. There was a general disregard to regulatory requirements. Deficiencies existed in employee training of Real Water. Many of these you're going to see from the FDA and the CDC. Deficiencies existed in Real Water standard operating procedures. Real Water had a deficient or non-existent food safety plan. Deficiencies existed in the Real Water customer complaint management. There was no management. It was free water. That was it. Next slide. This is what she said.
Okay, and the evidence whether or not Real Water should have tested its product with its GCMS machine.
Yes, particularly given the type of chemical converting they were doing, the electrolysis process, part of the preparation to concentrate, the very complex chemical process. They should have really been looking for what I might be manufacturing in addition to alkaline water.
Thank you. Next slide. And this is after she heard Mr. Marlowe. You guys recall Mr. Marlowe as the inventor of this process. Go ahead, Shane.
And do you agree with Mr. Marlowe that Real Water should have been testing and knowing what they were selling?
Yes.
Mr. Marlowe testified they should have tested before they actually sold the product. Dr. Hutt said they should have tested it before they sold the product. And we know, and it's undisputed, from the beginning, 2008 until 2021, never tested for hydrazine or any other known toxins. Not once. Next slide. Go right ahead.
So, I don't know, I always like to skip to the end of the movie. Let's say this is the second complaint, I don't know if it is or not. Is this the time when the root cause analysis should have been performed?
Oh, yes, as I said earlier, again, having run customer complaint programs for major corporations, the key is the red flag comes up after 2 or more similar complaints, particularly in the same condensed time period. This would have prompted a root cause investigation for any company that I worked with.
Right, and you work with very large companies, and I don't want this to leave the jury. Real Water had, we saw 30 employees. You believe it still applies?
Absolutely, because they had national distribution of their water to major suppliers like Costco and Whole Foods.
Doesn't matter. To small companies, if you accept what Mr. O'Doul was saying to Dr. Hutt, of 30 employees, does that make it all right to sell filthy, unsafe drinking water? Dr. Hutt has said that that's not the case. If you're selling a product, it should be safe. Did they bring someone on who could refute that opinion? You've not heard one. You've not heard anyone get on that stand and say that if you have a company of 30, 40, 50, 60 employees, that gives you a pass. You don't have to make it safe if you have 30 or 40 employees. Only if you have 35 or 45. There's no one who's testified to that because it simply isn't true. Real water is being sold across the country to companies like Costco and Whole Foods. National distribution. Next slide, Shane. Now this is the verdict form. Mr. Kemp went over this. I'm not going to spend much time with it, but I will indicate to you with the next page that Mr. DeQuante, like everyone else, is on this form. And I'm putting up larger numbers because of what DeQuante Brown, Henry went through. I apologize. So I'm doing panel right above his name. Because DeQuante went through not just more than what Blaine went through. In terms of past, he went through the biopsies. He went through multiple hospitalizations. He actually had end-stage liver failure. He received someone else's liver. He underwent that surgery. He had to sign a consent form saying that he may die on a table going through that surgery. That was an 8-hour surgery. Started at virtually midnight on the 30th. And I showed you earlier those records. That's what he went through. Not knowing he was going to even make it because he didn't know if there would be a donor liver for him. Put the next item. That's what I'm suggesting for Mr. DeQuante Henry. That's past. In terms of future, I'm suggesting this number. And I will tell you why. Every day, Mr. DeQuante Henry has to consider his mortality. Not like anyone else. He knows that in all likelihood, there's a 50% chance that he won't make 38 or 39. That's what he has to live with every day. On top of that, if the science is true, if the medical science is true, in the last years of his life, he'll be dealing with cancer, diabetes, hypertension, and in all likelihood have to be in a care facility in his 30s or have someone staying at his house caring for him because he won't be able to do for himself. That's what he's got to look forward to. That's what he has to look forward to in the next 10 or so years. Because 3 of them have already gone. 3 of them have gone in this litigation. That's what he has to look down the barrel of. So that's why I'm suggesting that number. Next slide. And this is the only, DeQuante is the only one who has this line. It's because he, we know for certain, has a shortened life because every expert has testified to such. And for this, I'm suggesting that number. Because in all likelihood, if he dies at 38 or 39, he will have lost 31 or 32 years of his life. Now, a lot of you are younger than I am, and perhaps you never heard this phrase. It was always taught to me. Hope for the best, but prepare for the worst. Real Water would have you treat these plaintiffs like everything good is going to happen to them. That their permanent injuries won't result in any further liver function problems. Including Mr. DeQuante Henry. That's what they would have you say. They brought their experts here to say, they look good. We don't know if they're injured permanently because we can't see for those who haven't had a recent biopsy. That's what they would have you, that's what the impression they would leave on you. Treat them as if only the best will happen to them from this point on. It's self-serving, ladies and gentlemen. It ignores the science. It ignores the medical information we have. I'm suggesting just $1 million a year for this 20s, a guy who's in his 20s. I want to say a kid because he's so much younger than me. And I apologize about that. But that's what I'm suggesting. You do whatever you want. I mean, you follow the jury instructions. You figure out what you believe as a jury is appropriate. But that's what I think is reasonable. Now, I will tell you, and I suspect, that Real Water will get up and say, we want you to be reasonable. And that's fine to say. But they created an unreasonably dangerous product. They've done unreasonable things. And now they're going to ask you to be reasonable. I want you to think of the hypocrisy of that. The irony of that. Those who seek grace, who ask for grace, should actually show it. Grace doesn't mean you ignore customer complaints, even when people die. You ignored 5 children being sent to the city, to Salt Lake City, not knowing what's going to happen with them. They were all potential liver candidates, all of them. And so are several of our plaintiffs. Ladies and gentlemen, I will get another chance to speak with you, because as a plaintiff, we go now, Mr. O'Doul will go tomorrow, and then we'll come after Mr. O'Doul. But I want you to consider that jury instruction. I want you to consider how these plaintiffs, all of them, have been treated, the experiences they've lived through, and how real water, in the last day of evidence, or last day and a half, had 3 experts come on simply to say because they look good, that they're okay. Every bit of evidence that we have in this case points to permanent injuries, and I will tell you, and you've heard it yourself, they're not okay. Thank you very much, ladies and gentlemen. You have a wonderful night, and we'll look forward to seeing you tomorrow.
All right, ladies and gentlemen, it's 5:15. That'll do it for this evening. And I'll just let you know what we're going to do. We're going to meet tomorrow at 10:30, and we'll finish up closing arguments, and then we'll break for lunch. Just let you know that. And then you'll start your deliberation. And so anyway, as you know, I'm required to read the admonishment to you. And remember, you're admonished not to converse amongst yourselves or with anyone else on any subject connected with this trial, or to read, watch, or listen to any report of or commentary on the trial by any persons connected with this case by any medium of information, including without limitations, newspaper, television, radio, social media. Remember the prohibition. And last but not least, do not form or express any opinion on any subject connected with this trial until the cause is finally submitted to you. And it'll be submitted to you tomorrow after that.
All rights report to the
10:30.
10:30.
And enjoy your evening.
Thank you, Your Honor.
Okay. Just a piece of cake. Very good. What? This is very right. That's okay.
You have to take it now.
You have to be done.
That's got cold